Okay, a very good morning to all of you. I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today I'm launching a new series. So today I'm going to teach you pharmacology super simplified manner. I am going to teach you a very important topic, a very important portion in pharmacology, that is complete antimicrobial drugs. So today we will be covering the antimicrobial drugs completely. All the antimicrobial drugs will be covered today, and today as usual it is a marathon session, right? So in the antimicrobial drugs, what are antimicrobial drugs? So antimicrobial drugs are the drugs which kills microbe, which acts on the microbes. What are microbes? There are four type of microbes. It can be a bacteria, it can be a virus, it can be a fungus, and it can be a parasite. So we can say there are four type of antimicrobial drugs. Antibiotic are the drugs which acts against bacteria. Antiviral are the drugs which acts against virus. Antifungal are the drugs which acts against fungus. And antiparasite में antiprotozoal and antihelminthic, the two type of parasites, are the drugs which acts against parasite. All these are antimicrobial drugs. So antimicrobial drugs includes four categories: antibacterial, antiviral, antifungal, and antiparasitic. We will be discussing them, all of them. The biggest portion is the antibiotic. So let's start with antibiotic only. Okay. So I will teach you all of them, but before that, let me classify. Let me classify antimicrobial drugs. So antimicrobial drugs can be classified based on six categories. So I will tell you six classifications, six different classification I will be telling you, right? The first classification is based on chemical structure. This classification is not at all important, but for your knowledge, you should be knowing that the chemical structure, right? Based on chemical structure, there are 17 different groups we divide the antibiotics or antimicrobial drugs into. So chemical structure is the chemical formula of the drug, right? So there are some drugs which have sulfone and amide group in them. They are known as sulfonamide. There are some antibiotics which have diaminopyrimidine group in them. There are some which is having quinolones. There are some which is having beta-lactam ring in them. There are some in which there are four rings. That's why known as tetracycline. The nitrobenzene, the benzene with a nitro group. Aminoglycoside is the amino which is glycosided with a sugar. Macrolide is a big ring, big ring. Lincosamides are there. Glycopeptides, oxazolidinedione. It can be polypeptide. It can be nitrofuran. It can be nitroimidazoles. So I don't recommend to learn this classification. But yeah, it is the classification based on the chemical structure of the drug. Based on the chemical structure, we divide the drugs into 17 different and 18 including others. So we divide into 18 different categories, but you should be knowing the different categories. Right, coming on the second classification, based on the type of organism against which it is active. As I have told you, there are four type of microbes. There are bacteria, there are fungus, there are virus, and there are parasites. Parasites are of two types, protozoa and helminth. So antibacterial are the drugs which acts against bacteria. Antifungal are the drugs which acts against fungus. Antiviral are the drugs which acts against virus. And antiprotozoal and antihelminthic both are the drugs which acts against parasite. So that is based on the type of the organism against which they are active. We can divide them into four categories. This is the second classification, right? The third classification is based on spectrum of activity. What do you mean by spectrum of activity? Some antibiotics are narrow spectrum and some are broad spectrum. What do you mean by narrow and broad? Narrow spectrum are the antibiotics which kill specific bacteria. Like penicillins kill only gram-positive bacteria, right? So it is a specific. It is they are not killing all. But broad spectrum are the antibiotics which kill all bacteria. Gram-positive also, gram-negative also. Gram-positive, gram-negative means gram-positive cocci also, negative cocci also, gram-positive bacilli also, gram-negative bacilli also. So all the bacteria will be killed. That is broad spectrum. So based on the spectrum, you should know. So for knowing the spectrum, you divide the bacteria into four categories. Always, please learn the spectrum. So it is gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. You should know this classification because when I will teach you individual category, I will teach you the spectrum of that particular antibiotic group. What I will be. Just suppose I will start the first chapter, sulfonamide. So what is the spectrum of sulfonamide? Which bacteria it is killing? So what is the spectrum of aminoglycoside? What is the spectrum of tetracycline? So in each antibiotic, I will be telling you the spectrum. In the spectrum, I will use these terminologies. They kill gram-positive cocci, negative cocci, bacilli. So you should be knowing this classification. So we divide bacteria into four categories: gram-positive cocci, gram-negative cocci. Both of them are cocci, means they are circular spherical. Gram-positive bacilli and gram-negative bacilli. Both of them are rods, the bacilli, right? So tell me the name of bacteria inside each category. The microbiology, you may be knowing that. Gram-positive cocci are only two, Staphylococcus and Streptococcus. That's it. Staphylococcus and Streptococcus are gram-positive cocci. Coming on gram-negative cocci, there are also two, Neisseria and Moraxella. Neisseria and Moraxella, they are not gram-negative cocci. Coming on gram-positive bacilli, they are five in number. The mnemonic is A, B, C, D, M, right? So it is Actinomycetes, it is Bacillus, it is Corynebacterium diphtheria, D for diphtheria, C for Clostridium, and M for, you can see here, M is monocytogens. So Actinomycetes, Bacillus, Clostridium, diphtheria, and monocytogens. So these are the five gram-positive bacilli, and remaining all bacteria are gram-negative bacilli. So based on that, we will say whether the antibiotic is narrow spectrum or broad spectrum. If the antibiotic is narrow spectrum, it may be killing one particular category. Maybe this, maybe this, maybe this, maybe this. And if the antibiotic is broad spectrum, it is an antibiotic which is killing all the bacteria. It is broad spectrum. So that is the third classification. Till now, we have seen three classification. That is based on chemical structure. We divide the antibiotics into 18 groups. But this classification, I don't recommend you to learn, right? The second type of classification is based on type of organism against which the drug is active. So it can be antibacterial, antiviral, antifungal, or antiparasitic. So based on the organism. The third, based on the spectrum of the activity. Based on the spectrum of the activity, whether they are narrow spectrum or whether they are broad spectrum. We have understood that also. The most important classification is based on their mechanism of action. The fourth one. So what is their mechanism of action? For explaining you mechanism of action, I would like to draw the diagram of one bacteria or one organism. So see, in this diagram, I am drawing, this is the cell membrane. Just above the cell membrane, this is the cell wall, right? All bacteria have cell wall, whether gram positive or gram negative. So one is cell membrane and outermost is the cell wall. Inside is the nucleus. Let me draw the nucleus. Inside the nucleus, this is the DNA. Can you see? This is the DNA. Inside the nucleus, this is the DNA, right? Now, see where protein synthesis take place. This is a ribosome on which this is the protein synthesis take place, right? Transcription, translation is taking place. So this is the cell of a bacteria. Now there are four type of antibiotics. There are some, start from outer side. There are some antibiotics which inhibit cell wall synthesis. So they inhibit cell wall synthesis. So cell wall synthesis will not occur and the bacteria will die. So these are cell wall synthesis inhibitors. Number one. Number one, there are some antibiotics which act on the cell membrane. They don't inhibit cell membrane synthesis. They causes pores. They causes holes in the cell membrane. If they cause holes in the cell membrane, all the vital will be leak out. All the cytoplasm will leak out and bacteria will die. So they cause pores in the cell membrane. So there are group of antibiotics. So there are antibiotics which act on the cell wall and inhibit the synthesis of cell wall. There are some antibiotics which causes pores in the cell membrane and causes killing of the bacteria. Number two. Number three, there are some antibiotics which inhibit nucleic acid synthesis. Nucleic acid synthesis. Now there are two types. Nucleic acid can be DNA synthesis inhibitor, can be RNA synthesis inhibitor, because nucleic acid is of two types, right? So DNA synthesis inhibitor, RNA synthesis inhibitor. That is the first thing. Again, we can classify like them. This also. They are direct inhibitors or they are indirect inhibitors. What do you mean by that? Whether DNA or RNA, they can be direct, they can be indirect. What do you mean by direct and indirect? So this is the DNA. DNA is made up of four molecules. That is adenosine, cytosine, thymidine, and uracil. Right? So you may be knowing the three molecules which is made up of DNA and RNA, the nucleosides. So some of the antibiotics directly inhibit the synthesis of the DNA. They are direct inhibitors. But for the synthesis of these nucleotides, folic acid is required. So some of the antibiotics inhibit the synthesis of folic acid actually. They don't interfere with DNA synthesis. They interfere with folic acid. So if folic acid will be absent, DNA will not be synthesized. So these are indirect inhibitors. You got my point? And the fourth and the last category, there are some antibiotics which inhibit protein synthesis. They act on the ribosome and inhibit protein synthesis in the bacteria. Now in the ribosome, there are two portions. This is 30S of the ribosome. This is 50S of the ribosome. You may be knowing we divide ribosome into two portions, 30S and 50S. So some act on 30S of the ribosome and inhibit protein synthesis, and some act on 50S of the ribosome and inhibit protein synthesis. These are protein synthesis inhibitors. So these are the four categories of the antibiotics which are acting on a bacteria or a microbe. Everyone give me a thumbs up. You got my point? Sufi, you got my point? Is it? So what are the four categories? So there are some antibiotics which inhibit cell wall synthesis. There are some antibiotics which causes pores in the cell membrane. There are some antibiotics which inhibit nucleic acid synthesis. Now nucleic acid can be DNA, can be RNA. They can be direct inhibitors, they can be indirect inhibitors, right? Indirect inhibitors means they inhibit folic acid, not directly nucleic acid. And there are some antibiotics which inhibit protein inside the bacteria, protein synthesis. So protein synthesis, they are acting on ribosome. So some act on 30S, some act on 50S. So these are the four categories of antibiotics based on their function, based on their mechanism. So based on the mechanism of action, we classify them into four categories. The four categories are written in front of you. There are some antibiotics which act on the cell wall and inhibit cell wall synthesis. There are some antibiotics which act on the cell membrane and causes pores in the cell membrane so that cytoplasm leaks out and the bacteria will die. There are some antibiotics which inhibit protein synthesis and there are some antibiotics which inhibit nucleic acid synthesis. You got my point? Amar, you got my point. What about others? So same diagram is drawn in front of you. Here also you can see there are some antibiotics which are acting on the cell wall. See here. They are acting on the cell wall. There are some antibiotics which are acting on the cell membrane. Cell membrane. There are some antibiotics which act on the nucleic acid synthesis and there are some antibiotics which act on the protein synthesis and synthesis inhibition, that is on ribosome. The four categories are in front of you. Now it's important to learn the list of the bacteria. So let's talk about the first category, cell wall synthesis inhibitor. There are 5 cell wall synthesis inhibitors, all beta lactams. You know, there are 4 type of beta lactams. You may be knowing that and I will teach you all this in detail. This is just a classification. We have to study each category in detail, right? That we will study today only in the most simplified manner. In beta lactam, antibiotics, it is penicillin, cephalosporin, monobactam, and carbapenem. The four type are beta lactam. All beta lactam act by same mechanism. They inhibit cell wall in the bacteria. After that, vancomycin, bacitracin, cycloserine, and phosphomycin. These are also, but not very important. These are the 5 antibiotics, you can say. They inhibit cell wall synthesis in the bacteria. You can see all the names are written here. So all the beta lactams, vancomycin, bacitracin, cycloserine, and phosphomycin. These are inhibiting cell wall in the bacteria. That's why killing the bacteria, and these all are bactericidal. They kill the bacteria, right? Coming on the second category, the one which cause cell membrane holes. They cause leakage from the cell membrane by creating pores in the cell membrane, holes in the cell membrane. They are 3 category, all azoles. You know, antifungal drugs, azoles, ketonazole, fluconazole, itraconazole, azole. So all azoles act by this mechanism. Number 1, all polyenes, again antifungal drug like amphotericin B, nystatin, harmazine, all polyenes. These are also antifungal. These are also antifungal. They also act by this mechanism. So these are 2 important categories, azoles and polyenes, which act by this mechanism. So you can see here cell membrane inhibitors. These are also bactericidal. The bacteria will be killed. Coming on the third category, the drugs which inhibit protein synthesis. Now, some of them act on 30S of the ribosome, some of them act on 50S, some of them act on both 30 plus 50S, right? But they are 7 in number. But out of the 7, the first 4 are super duper important that we will study today in a comparative manner. The tetracyclines, aminoglycoside, chloramphenicol, and erythromycin. Apart from it, clindamycin, linezolid, and streptogrammin is also there, right? You have to learn the names. So these are the one which inhibit protein synthesis, you can see, right? So they all are bacteriostatic. They don't kill the bacteria, but they stop the bacteria from cell division. Now they can be divided into the one which act on 30S, the one which act on 50S, and the one which act on both 30 plus 50S. But I am not going in that detail because when I will teach you the detail of each of them, I will tell you individually that which antibiotic is acting on which S of the ribosome. Then you can correlate retrograde, right? So it will be better. So the last category, tell me the name of the antibiotics which inhibit with nucleic acid synthesis, right? So some inhibit directly, that they directly inhibit DNA and RNA synthesis. Some act indirectly. By indirectly, I mean they inhibit folic acid synthesis inhibition, and folic acid is required for DNA RNA. So some are direct inhibitors, some are indirect inhibitors. If I say direct inhibitors. So best example is quinolones, right? All quinolones, right? Fluoroquinolones, all of them, they are direct inhibitors, right? Metronidazole, it is a direct inhibitor, right? So these are the rifampicin. Rifampicin is a direct inhibitor of RNA, and these are direct inhibitors of DNA, right? So DNA and RNA. If I talk about indirect inhibitors, so sulfonamide and trimethoprim are the best example. I am summarizing. Everyone look on the screen. So let me draw the diagram of a bacteria. This is the cell membrane of a bacteria. This is the cell wall of a bacteria. Inside the bacteria, This is the nucleus of the bacteria having DNA or RNA, and this is the ribosome 30S and 50S. On ribosome, this is the protein synthesis taking place. If we want to kill this bacteria or if we want to inhibit the cell division in this bacteria, so there are four mechanisms. The first mechanism, there are some antibiotics which inhibit cell wall synthesis. Number one, there are some antibiotics which causes pores in the cell membrane. So the one which are acting on the cell wall, the outermost green color cell wall. There are some which act on the cell membrane. You know this blue color cell membrane, and they cause pores in the cell membrane. So they are causing pores in the cell membrane, not inhibiting the synthesis. The third, there are some which act on the ribosome and they inhibit protein synthesis, right? They inhibit protein synthesis. And the last one, there are some which inhibit nucleic acid synthesis. They inhibit. So these are the four categories of the antibiotic. In this way, they can either kill the bacteria, that is bactericidal, or either inhibit the cell division in the bacteria, that is bacteriostatic, right? So ultimately, they are limiting the growth of the bacteria and they are used for the treatment. So four categories are there. The one which inhibits cell wall synthesis, you can see. The one which causes pores in the cell membrane, you can see the pores. The one which inhibit protein synthesis by acting on the ribosome 30S, 50S both. And the one which inhibit nucleic acid synthesis. The one which inhibit nucleic acid synthesis are of two types. Some of them are direct inhibitors, some of them are indirect inhibitors. By direct, I mean they are directly inhibiting the DNA RNA synthesis. By indirect, I mean they inhibit folic acid synthesis inhibition, and folic acid is required for DNA and RNA. Can any one of you tell me the name of drugs in each category? Can anyone of you can anyone of you can tell me the name of drugs in each category? Tell me the name of the drugs which inhibit cell wall synthesis. Can you tell me the name of the drugs? Cell wall synthesis inhibitors. All beta lactams. All beta lactams. There are four beta lactam antibiotics, that is penicillin, cephalosporin, carbapenem, and monobactam. So these are the main cell wall synthesis inhibitors. Can you tell me the name of the drugs which causes pores in the cell membrane? Can you tell me the name of the drugs which causes pores in the cell membrane? So all azoles are there. There are many azoles, that is antifungal, and polyenes, that is amphotericin B. So these are antifungal drugs. Can you tell me the name of the drugs which inhibit protein synthesis? There are four main drugs: tetracycline, chloramphenicol, aminoglycoside, and the last one is erythromycin or macrolide. These are the important protein synthesis inhibitors. And can you tell me the name of the drugs which inhibit nucleic acid synthesis inhibition? So there are direct inhibitors and indirect inhibitors. In direct inhibitors, you can say quinolones are the best example. In indirect, and rifampicin, right? In indirect inhibitors, trimethoprim and sulfonamide. So that is the classification in front of you, right? Now I will start teaching you individual drug and you will really enjoy it. I will start from nucleic acid synthesis inhibitors. So first I will teach you, the first chapter I am going to teach you trimethoprim. The second chapter I am going to teach you sulfonamide and trimethoprim. Then I am going to teach you quinolones. So nucleic acid, important nucleic acids inhibitors is done here. After that, I will come on this category, the drugs which inhibit protein synthesis. So I will teach you these four in a comparative manner, the most important chapter. Then I will come on cell wall synthesis inhibitors, that is beta lactams. I will teach you four chapters here. And in the end, I will teach you cell membrane में pores कराने वाले, that is I will teach you antifungal drugs here. So in this mechanism, in this sequence, I will move further. You got my point? So that is the classification. The same thing is shown here also. In this, you can also notice this is cell wall. So you can see these are the one which are acting on cell wall. This is cell membrane. These are also on the cell wall. This is the cell membrane. You can see these are acting on the cell membrane, right? You can see these are acting on the DNA and these are acting on the RNA, and these are the protein synthesis inhibitors. So you can see the classification. So till now we have seen four classification. Based on chemical structure, we divide the antibiotics into 18 categories. Based on the type of organism against which they are active, we divide the antibiotics into four categories: antibacterial, antiviral, antifungal, and antiprotozoal. Right? Based on the spectrum of activity, we divide them into two categories. That is broad spectrum and narrow spectrum. Broad spectrum kill all four categories. Gram positive होगा है, gram negative होगा है, gram positive bacilli, gram negative bacilli. I hope you know the bacteria inside each category. And narrow spectrum will kill only one of the category, not all. Right? Based on mechanism of action, we divide them into four categories. The one which inhibits cell wall synthesis, you know the names. The one which causes pores in the cell membrane, you know the names. The one which inhibit nucleic acid synthesis, you know the names. And the one which inhibit protein synthesis, you already know the names. Give me a thumbs up. Give me a thumbs up. Now coming on the fifth classification. The type of the action. What is their type of action? Based on their type of action, there are two types, bactericidal and bacteriostatic. What do you mean by bactericidal and bacteriostatic? See, this is a growth plate. This is a growth plate, and you can see how many colonies are there. 1, 2, 3, 4, 5, 6, 7. I can find few colonies. If I give no antibiotic, nothing is given. They will grow, and see colony number is increasing abruptly. The colony numbers, the bacteria are dividing, they increase abruptly. Same can happen inside human body also. This is in vitro, the same is happening in vivo. So we are giving antibiotic to the patient. That's why we are giving antibiotic. So antibiotics are of two types. Can you see here I'm putting the antibiotic on this growth plate. If there are some antibiotic that kills all the bacteria, so none of the bacteria is present. So such antibiotic is bactericidal. The word cidal means killing. It is killing all the existing bacteria. The second type of antibiotic I'm putting on the growth plate, C. Count the number of colonies here, count here. It is 7 here, 7 here. Whatever is the number, means they are not killed, but they are not increasing in number also. So there are some antibiotic which inhibit the cell growth, the bacterial cell division. These are known as bacteriostatic. So basically, there are two type of antibiotics based on their action, bactericidal and bacteriostatic. Can you tell me the difference? Cidal are the one which kills bacteria. Static are the one which do not kill the bacteria but inhibit the cell division in the bacteria, inhibit the binary fission cell division. Give me a thumbs up, everyone. So that is based on their action. They are of two type, bactericidal. Now among them, which of them are bacteriostatic and which of them are bactericidal? This is the complete list. But when I will teach you individual one, I will explain you why any category is bactericidal and why any category is bacteriostatic. So based on the action, we divide them into two categories. The last one, tell me the source of the antibiotic, from where they are obtained. So antibiotics are obtained either from the fungus or from the bacteria or from the actinomycetes with the help of genetic engineering. With the help of genetic engineering, we obtain the bacteria, we obtain the antibiotic either from fungus or bacteria or actinomycetes. So you can see the names which of them are obtained from fungus. You can see the name which of them are obtained from bacteria. And you can see the names which of them are obtained from actinomycetes. So not a very important classification, but here. So there are 6 ways of classifying antimicrobial drugs. Everyone give me a thumbs up so that I can start the first chapter. Now I will start individual chapters. Are you people there? Shall I start? So can you help me in revising the 6 ways of classification of antimicrobial drugs? The first way is based on chemical structure, based on which we divide the antimicrobial drugs into 18 different classes, but not important. Based on the type of organisms against which they are active. So either they are antibiotic, that is antibacterial. They can be antiviral, they can be antifungal, and they can be antiparasitic. The antiparasitic are further two type, antiprotozoal and antihelminthic. We will be studying all today. The biggest one is the antibiotic. We will start with antibiotic only. Then I will teach you antifungal. Then I will teach you antiviral. And in the end, I will teach you antiparasitic. Today only we will study everything. Everyone give me a thumbs up. Based on the spectrum of activity, it is of two types. They can be broad spectrum. They can be narrow spectrum. You know the meaning of broad and narrow spectrum. Based on the mechanism of action, the most important classification, there are 4 types. The one which inhibits cell wall synthesis inhibitor, the one which causes pores in the cell membrane, the one which inhibit nucleic acid synthesis, and the one which inhibit protein synthesis. So based on their mechanism of action, there are 4 types. Based on the type of action, they can be bactericidal, they can be bacteriostatic. You know the difference between them. And based on from where they are obtained, what is their source? They can be obtained from fungus, they can be obtained from actinomycetes, and they can be obtained from bacteria. So based on each category, you should tell me the name of the drugs inside each category. Give me a thumbs up. Shall I move ahead? Many questions are simply solved from the classification. If you know the classification thoroughly, you should know the name of the drugs inside each category in each classification. Many questions you can solve simply. Your MCQs in your exam. Shall I proceed? Let me start the first chapter, the first 3 chapters, right? I'm starting the first 3 chapters. Now, I teach antimicrobials in a unique way. So, in this classification, more than 20 or 25 categories are there. I'm going to teach you all today. But how you will learn? Now, it is a very volatile topic, right? Today you will learn, you will feel, yes, I'm confident. But the very next day, you will feel like I forgot everything. What were the uses of this drug? What were the adverse effect of this drug? I'm mixing the uses, I'm mixing the adverse effect, I'm forgetting. You will feel like that, right? Is it true? Do you feel like that? So the best way, the unique way, the best way to study them in a comparative manner, right? I request all my dear students to make the columns like this in a comparative manner of each category. Let me start nucleic acid synthesis inhibitors, right? Start with nucleic acid. Then we will come on protein. Then we will come on cell membrane and we will come on cell wall. In this way, we will cover all 4 categories. You know the mechanism of action. These all are nucleic acid synthesis inhibitors, right? So let's compare these 3, right? The unique way is that the headings are fixed. So start with the introduction. In the introduction, tell me the structure or some important point about these categories. Then tell me the classification, which is the most important. You should know classification of all antimicrobial drugs. You should know. You should know. Coming on the spectrum. In the spectrum, you have to write whether gram positive cocci or gram negative cocci or gram positive bacilli or gram negative bacilli or all of them. Right? You have to write specific spectrum. Now, why spectrum is important? You are doctor now, so whenever any patient coming to you, doctor, I'm having this symptom, this symptom, this symptom, so based on the symptom you will come to a diagnosis that this patient is having infection with a particular bacteria. The name of the bacteria is this. You will apply the culture and other tests. Based on that, the bacteria is either a gram positive, gram negative, cocci or bacilli. So you want to give some specific antibiotic that kills only that bacteria. And if you are not sure, you will give broad spectrum. So being a doctor, you should know the narrow and broad, the spectrum of all antibiotics, right? Coming on the most important heading is the mechanism of action. What's the mechanism of action of that particular drug, right? So in this, you have to draw the flow chart with the diagram. I always give flow chart here. Then tell me the resistance. Nowadays, bacteria are developing resistance. So tell me the ways how bacteria are producing resistance for that particular antibiotic. Adverse effect and uses, I always used to give mnemonics. I always used to give mnemonics, multiple mnemonics. In each category, you will have two mnemonics, one of uses, one of adverse effect. With the help of mnemonic, you can fit it in your permanent memory and you can solve technically any MCQ based on that. Shall I start? Shall I start? Give me a few minutes. You yourself will realize this is the easiest way in the world to retain all antimicrobial drugs. I'm starting the first chapter. These all drugs, the three drugs, these all are nucleic acid synthesis inhibitors. Right, nucleic acid. So the first two, sulfonamide and trimethoprim cotrimazole, these are indirect inhibitors and quinolone is a direct inhibitor. But all of them are nucleic acid synthesis inhibitor. Shall I start? The first category, the three drugs. So please make this table with me. I request all the students to take the notebook out, to take the pen out and start making this table with me. If you are not following my commands, you are doing a big mistake and you will realize at the end of the session that मैम ने कहा था साथ साथ में बना लेना चाहिए था. So please take it out. Right? So take it out and start making. So start the first chapter and start filling this table, this column. Start filling this column in the first chapter. Start the first chapter, sulfonamide. Start the introduction. Why sulfonamide is known as sulfonamide? See, it is a benzene. You all can see this is a benzene. In the benzene or carbon number 1, there is a sulfo group and on carbon 4, there is an amide group. So that's why known as sulfona-amide. Sulfona group and amide group. So the carbon number 1 is sulfona and carbon number 4 is amide. So don't learn the exact structure, but you never know your MCQ is coming on which point the next year exam, right? So just learn the carbon. So on carbon number 1, it is sulfona group and carbon number 4 it is amide on a benzene. So that's why known as sulfonamide. A broad you have to learn the structure. So that is the thing. That is the thing, right? Now, in the introduction, write one more unique feature. We never give sulfonamide alone in a patient. We always give sulfonamide with trimethoprim. These two are given in combination. Neither this is given alone nor this is given alone. Why? Because if we give alone sulfonamide or if we give alone trimethoprim, bacteria develops resistance and they don't die. If we give them in combination, the bacteria die. The combination is known as cotrimoxazole. 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 So the combination is the cotrimoxazole. We never give this alone. We never give this alone. We give both of them in combination always. This is a rule. So write this point in the introduction, right? Because initially we give sulfonamide alone extensively, but nowadays bacteria develop resistance. So if we give alone sulfonamide, bacteria don't die. They develop resistance. That's why we always give sulfonamide in combination with trimethoprim, and trimethoprim and sulfonamide combination is known as cotrimoxazole. So this is a rule. Please learn this rule. Write down in the introduction. After introduction, come on the classification. Come on the classification. We divide sulfonamide into 5 categories: the short acting, the intermediate acting, the long acting. So that is based on their mode of action, right? The duration of action: short, intermediate, long acting, right? After that, topical. Topical are in the form of the ointment and eye drops, right? Topical, not the systemic one, topical one. And last are special, the special one for rheumatoid arthritis and ulcerative colitis. This category is known as special category. So short, intermediate, long acting, after that topical one, and after that special. So it's very difficult classification, I'm warning you. But still, I will try to simplify and show you the MCQs which come in the PYQs from this classification. I'm teaching you classification of first chapter, sulfonamide. I'm teaching you sulfonamide right now, right? So short acting में देखो sulfa तो सब में है. Don't read sulfa. So short acting में it is diazine, sulfadiazine, sulfamethizole, sulfacysteine, and sulfasoxazole. Say it is diazine, soxazole, methizole and cysteine. I learn like that. Sulfa. Don't learn sulfa. Sulfa तो सबको पता है. उसके आगे का बोलो. It is diazine. Number one is diazine. Number two is soxazole. Number three is methizole. And number four is cysteine. So that your concept will become clear. That is short acting. They are four in number. Coming on intermediate acting. Again sulfa को छोड़ो. Methoxazole. Now compare this methizole and methoxazole. Don't get confused. Methizole is short and methoxazole is intermediate. Give me a thumbs up. Give me a thumbs up. Coming on the long acting. Sulfadoxine. Now compare this diazine and doxine. Don't get confused. Diazine is short and doxine is long. Who will tell you इतना खोल खोल के इतना अच्छे से? Who will tell you? Right? And long acting में one more. Methopyrazine. Now don't get confused. The 3M. Methizole is short. Methoxazole is intermediate and methopyrazine is long. Everyone give me a thumbs up. Amar, have you got it? Sufi, Ujjwal, others? I can't see the name of the others. Everyone give me a thumbs up. Have you got it? The short one, intermediate one, long one. Coming on the topical are easy to identify. In the topical, one is sulfa acetamide sodium. So acetamide is nowhere. It is unique. So you will identify it. Acetamide sodium. Sulfa acetamide sodium. Mephenide is not starting from sulfa. So it is also unique. You will identify that it is the topical one. The third one is the short only. Sulfadiazine. The same sulfadiazine. Can you see this one? The same sulfadiazine, but we are acting silver in that. If we add silver in that, it will become topical. If only sulfadiazine, it is short acting. But sulfadiazine along with silver, it is topical. Right? Abhi main questions dikhati hu. I will show you the MCQs which are asked in the previous year of NEET PG FMG. So you will confuse. You will confuse from the classification. I will show you the questions right now. Right? And coming on the special category, Salazine. Everyone give me a thumbs up. Let me erase it and let me go back on the same page so that we can revise it. Everyone give me a thumbs up. Can we classify the sulfonamides? Yes. We classify based on their duration of action. Short acting, intermediate acting, long acting. Then one of them are topical. Topical means eye drops and ointments and tubes, right? Not tablets, not injections. And last one are the special category. The special category is for rheumatoid arthritis and ulcerative colitis. So divide them into 5 categories. पहले तो 5 categories के नाम बताओ, right? After that, tell the name of the drugs inside each categories. Short acting is diazine, soxazole, methizole, cysteine, and sulfa. Sulfadiazine, sulfasoxazole, sulfamethizole, sulfacysteine. So don't learn sulfa. If you learn sulfa ही fit होगा दिमाग में and in the exam you will get confused. Learn the suffix. Don't learn the prefix because prefix is same in all of them. Learn the suffix. Learn the suffix, right? So that is the thing. Intermediate में methoxazole. Don't get confused between methizole and methoxazole. Long acting में doxine. Don't get confused between diazine and doxine. I'm clarifying it. And the next one is methopyrazine. Now there are 3M. Methizole, methoxazole, methopyrazine. You yourself decide which is short, which is intermediate, which is long. Topical are easy. You will not get confused in topical because their names are unique. Acetamide, right? There is no other acetamide. Mephenide is not even starting with sulfa. इसके prefix में sulfa नहीं है. The only one which is not having sulfa in the prefix. Rest all have sulfa in the prefix, right? Mephenide and sulfadiazine is short acting, but if you add silver, it will become topical, right? And special means salazine, right? So say it again and again, you will learn, right? So, okay, coming on the spectrum, don't learn the spectrum. You can see a big spectrum. They are broad spectrum. I mean, they act against all. They act against gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. Don't learn individual bacteria. According to me, there will be no question on that. Coming on mechanism of action. Listen, what they do. Listen now. Listen. In the body, how folic acid is formed? In the bacteria. Let me talk about the cell of the bacteria. This is a cell of the bacteria. Can you see? This is a bacterial cell inside which folic acid is formed. How folic acid is formed? Folic acid formed from PABA. What is the full form of PABA? Para-aminobenzoic acid. PABA. You may have heard PABA. So para-aminobenzoic acid converted into dihydrofolic acid, DFHA. And dihydrofolic acid convert into tetrahydrofolic acid, which is the main folic acid. हम कहते हैं ना folic acid. Actually वो THFA होता है. Tetrahydrofolic acid is the active form of folic acid. So this is how folic acid is formed. So for the formation of folic acid, 2 steps are required, 2 enzymes are required. The first enzyme convert PABA to DHFA. The first enzyme. The name of that enzyme is folate synthetase, FS. Folate synthetase convert PABA to dihydrofolic acid. The second enzyme convert dihydrofolic acid to tetrahydrofolic acid. The name of this enzyme is folate reductase. This is folate synthetase. This is dihydrofolate reductase. Folate reductase. So dihydrofolate reductase, you can say. The two enzymes are in front of you, right? Now I'm going to teach you two chapters one by one. Currently, I am teaching you the first chapter. My first chapter is sulfonamide, and my next chapter, when I will teach you, is trimethoprim. I have told you both of them are used in combination, and the combination is known as quadri. They are not used alone. Neither sulfonamide used alone, nor trimethoprim used alone. They are used in combination, and the combination is known as quadrimoxazole. Right? See, sulfonamide inhibit this enzyme. So sulfonamide inhibit the conversion of PABA to DHFA. गलती से थोड़ा बहुत कन्वर्शन हो भी गया, किसी ने रेजिस्टेंस क्रिएट कर भी लिया, तो द सेकेंड कन्वर्शन दैट इज DFHA to THFA, dihydrofolic acid to tetrahydrofolic acid, is done by another enzyme, dihydrofolate reductase, and that is inhibited by trimethoprim. Right? So it is a sequential blockage. What it is known as sequential blockage. So the two drugs in combination, they are doing sequential blockage, and they are complementing each other's action. Is the complement word suitable here? Yes, they are complementing each other's action, and that's why this is the best combination. Give me a thumbs up. So ultimately, inside bacteria, folic acid will not form. You will say, "तो क्या हुआ मैम? In the bacteria, folic acid is absent, but folic acid is required for DNA synthesis, without which DNA cannot be synthesized. Folic acid is required for DNA synthesis. So if folic acid is absent, DNA cannot be synthesized, nucleic acid cannot be synthesized, and the bacteria will die. So this is how they act. Give me a thumbs up. Everyone give me a thumbs up. Do you have any doubt in that? I guess no. So you have to write like this. You have to write like this, right? The same thing is written here also. It is PABA get converted into dihydrofolic acid. Dihydrofolic acid convert into tetrahydrofolic acid. And tetrahydrofolic acid is required for DNA. So two enzymes are required for this conversion. For the first conversion, folate synthetase is required, and for the second conversion, dihydrofolate reductase is required. Right? Sulfonamide inhibit this enzyme, and trimethoprim inhibit this enzyme. That's why used in combination. The combination is known as quadri. Everyone give me a thumbs up. Avinash, Jobin, Sufi, Amar, give me a thumbs up. Right? So you have to write like this. So basically, sulfonamides are competitive inhibitors of PABA. Right? They are inhibiting the enzyme folate synthetase. The folate synthetase enzyme is inhibited, and they inhibit the conversion of folic acid, PABA to folic acid. Right? And folic acid is not formed, so DNA is not formed. Give me a thumbs up. Come on, have you got it? Shall I come with the adverse reaction? We are done with mechanism of action. Do you have any doubt in this? Okay. So coming on the adverse reaction, I have told you for adverse reaction as well as uses, I will try to give you mnemonic. I will try in maximum in 90% cases I will give you the mnemonic. The mnemonic here is ABC of rash. This is the mnemonic. ABC of rash, A stands for aplastic anemia. So sulfonamides causes aplastic anemia. They suppress bone marrow, and they causes aplastic anemia. So patient have pancytopenia, not RBC, not WBC, not platelet, nothing will form. Less RBC, less WBC, less platelet. Patient have anemia, thrombocytopenia, leukopenia. Patient have pancytopenia due to aplastic anemia because they suppress bone marrow a little bit. The second B, ABC ka B. B stands for bilirubin displacement. Normally in the blood, bilirubin is bind with the albumin, right? Bilirubin is bind with the albumin, but they have more affinity for the albumin. So this is the blood vessel of a person inside which normally bilirubin is present. Let me draw bilirubin molecule. This is bilirubin. Bilirubin is present on albumin. This is albumin. Albumin protein. Bilirubin is normally present on albumin. Now we don't take sulfonamide daily. Just suppose I am having some infection. You are a doctor. You said, "Ma'am, you take sulfonamide, you will be all right." You take cotrimoxazole, it contains sulfonamide, you will be all right. So I am taking sulfonamide as you have prescribed me, right? So this is the drug. This is my drug. So this sulfonamide have more affinity for the albumin. So what it will do? It will displace the bilirubin from the albumin and itself bind with the albumin. So basically bilirubin will become free. The bilirubin will become free. Once the bilirubin will become free, the bilirubin will enter the brain. The free bilirubin have a tendency to enter the brain. It will enter the brain in the basal ganglion. It will deposit it, and it will cause a disease known as kernicterus, especially in neonates. So kernicterus will happen. Give me a thumbs up. This is known as bilirubin displacement. So sulfonamides, what they are doing? Sulfonamides are displacing the bilirubin. They are displacing the bilirubin, and the free bilirubin is damaging the brain, the basal ganglion of the brain, causing kernicterus. So B for bilirubin displacement. Am I right? B for bilirubin displacement. उससे याद आना चाहिए kernicterus. Kernicterus कैसे होगा? You will know the mechanism. You know the mechanism. C stands for crystal urea. Split the tongue. Crystal urea means urine में crystals. So sulfonamide is excreted in urine. It is a drug which is excreted in urine, but it forms crystals in the urine. So sometimes patients have problem in the micturition, painful micturition and urinary tract infection. So crystals in the urine, right? Number three, crystals in the urine. R for rash. You know R for rash. Rash means hypersensitivity. So it is the most common side effect. Hypersensitivity is a side effect of by default all antibiotics. और कोई एडवर्स इफेक्ट आए ना आए, हाइपर सेंसिटिविटी तो सबसे होता है, एलर्जी तो सबसे होता है, रैश तो सबसे होता है, राइट? वन ऑफ द साइड इफेक्ट. A is for acetylation. Acetylation is not a side effect but an important point. You know, there are various ways of metabolism of all the drugs. The drugs get metabolized in the liver. So there is phase 1 metabolism, phase 2 metabolism. In phase 2 metabolism, you may have learned in general pharmacology, there are various conjugation, glucuronide conjugation, methyl conjugation. So acetylation is one of the conjugation. So it is one of the drug which is acetylated, right? It is an important MCQ. And S is SLE. It causes SLE like symptoms, right? And H is hemolysis in G6PD deficiency. In G6PD deficiency patient, if you give sulfonamide, hemolysis, there are chances of hemolysis. Kernicterus kaise hoga? I have explained you how the kernicterus will happen. Crystalluria, I have explained you. It is due to the precipitation in the urine. In the urine, they will form precipitate and they will form the crystals, right? So whenever you are a doctor, you are prescribing sulfonamide to your patient. Ask the patient to drink plenty of water along with it. Otherwise, it will form crystals in the urine if you don't drink water. And alkaline the urine by giving some alkalining agent to the patient, right? तो कोई alkaline agent दे दो जिससे urine alkaline हो जाए. In alkaline urine, crystals will not form. So these are the two preventions. These are the two preventions. Hypersensitivity reaction तो किसी को भी हो सकता है. Coming on the uses, as I have told you, it is never used alone. It is never used alone. Sulfonamide mostly used with trimethoprim, and the combination is known as cotrimoxazole. Cotrimoxazole, I guess everyone knows it. And the second combination, sulfonamide, is used with pyrazinamide, pyrimethamine. Either it is used in combination with pyrimethamine or it is used in combination with trimethoprim. So sulfonamide plus pyrimethamine and sulfonamide with plus trimethoprim. This combination is known as cotrimoxazole. But the first combination, there is no peculiar name. You got my point? Try pyrimethamine. So sulfonamide either used with pyrimethamine or sulfonamide used with trimethoprim. Right? This I mean. The sulfonamides are never used alone. This combination, no peculiar name, but this combination is known as cotrimoxazole. Either say cotrimoxazole or the brand name of cotrimoxazole is Septran. Septran. You may be knowing that. So one and the same thing. Like paracetamol is Crocin. So cotrimoxazole is Septran. So Septran is the brand name, right? Septran. It is available by the name of the Septran in the market. Septran is cotrimoxazole. It contains both drugs. Listen. So tell me the uses of, I'm asking the uses of sulfonamide. So the first thing you must tell me, ma'am, sulfonamide is not used alone. So either it is combined with pyrimethamine or it is combined with trimethoprim, right? So I will tell you, okay, tell me the uses of this combination and tell me the uses of this combination. Tell me the uses of combination then, right? So uses of this combination are only two. Sulfonamide with pyrimethamine. Only two uses are there. Number one, toxoplasma. You know what is toxoplasma? It is one of the parasitic infection. And number two, resistant malaria. It is also a parasitic infection, plasmodium. You are knowing that. So toxoplasma and malaria. These are the two uses of this combination. Okay, leave this combination. Come on the second one. Tell me the uses of Septran. Septran, cotrimoxazole. So there is a mnemonic. There are many uses. So there is a mnemonic. Here only two are there, so no mnemonic is required. But here I am having a mnemonic. The mnemonic is Septran itself. I will tell you the full form of Septran. Okay, see now, sulfonamide is never used alone. So sulfonamide is used either in combination with pyrimethamine. So two uses, resistant malaria and toxoplasma. Or it is used in combination with trimethoprim. So the combination is known as cotrimoxazole or Septran, right? So this is the Septran, full form of Septran. The mnemonic is Septran. I'm telling you the uses of sulfonamide plus trimethoprim. Is combination ki uses as Septran. S for STD. It is used for sexually transmitted disease, right? Like chancroid, LGB. These are the sexually transmitted disease. So it is used in that. Give me a thumbs up. E for anthritis. Anthritis means diarrhea. Diarrhea by E. coli, Shigella, gram-negative bacteria. P for Nemocystis carinii and Nemocystis jejuni, the two fungus, Nemocystis fungus, right? T for typhoid. R for respiratory tract infection, RTI. ए बहुत बेकार है, ए नहीं है एक्चुअली, वो यू है, इट इज यू, राइट? इट इज एक्यूट, ए को मैंने एक्यूट बना दिया क्योंकि निमोनिक कंप्लीट नहीं हो रहा था. इट इज यूटीआई, urinary tract infection, right? And N is nocardia. N is nocardia. Everyone give me a thumbs up. I am summarizing. So tell me the uses of sulfonamide? Who will tell me? The first point, it is never used alone, it is used in combination. So two combinations are possible. Sulfonamide is used in combination. So two combinations are possible. The first combination is pyrimethamine. The second combination is trimethoprim. This combination have no particular name, but this combination is known as cotrimoxazole. This combination is known as cotrimoxazole or Septron. So who will tell me the uses of this combination? Only two uses. And who will tell me the uses of this combination? Six uses. Who will tell me? Here only two uses are there. Number one is toxoplasma and number two resistant malaria. Resistant malaria. That is the uses of this combination. Coming on the second combination, Septron is the mnemonic. Septron. So seven uses are there. Septron. S stands for STD. E stands for enteritis, that is diarrhea by gram-negative bacteria E. coli and Shigella. P stands for Pneumocystis carini and Pneumocystis jejuni. T stands for typhoid by Salmonella. R for RTI, urinary, that is respiratory tract infection. A for UTI, A को U बना लेना. It is UTI, acute UTI. You can say A for acute UTI, urinary tract infection. N for nocardia. Everyone give me a thumbs up. Everyone. So I'm done with the uses also. The summary of the first chapter is in front of you. Everyone on the screen. Tell me the summary of the first chapter. Who will tell me? Tell me the introduction. In the introduction, why sulfonamides are known as sulfonamide? Because of sulfona and amide group. Sulfona group is present on carbon 4 of benzene. I have shown you the diagram. And amide group is present on carbon 1. Classification. Who will tell me the classification? Short acting, intermediate acting, long acting, topical and special. You know the drugs in each category. Say yes or no. Yes or no. Coming on the spectrum, say broad spectrum. Simply say broad spectrum, gram positive, negative, cocci, bacilli, everything. Mechanism of action in one word, you say. It inhibits the enzyme known as folate synthetase, which is required for the conversion of PABA into dihydrofolic acid. Give me a thumbs up. Resistance ke base, okay, you can leave. Adverse effect. The adverse effect, there is a mnemonic ABC rash. What is the adverse effect? ABC rash. What is ABC rash? A is aplastic anemia. B is bilirubin displacement, that is Kernick Terrace. C is crystalluria. R is rash, that is hypersensitivity. A क्या था? I forgot it. A is acetylation. S and H. S is SLE and H is hemolysis and G6PD deficiency. Yes or no? Uses, we have just discussed the mnemonic is Septron. It is STD, enteritis, Pneumocystis carini and jejuni, typhoid, RTI, UTI, and nocardia. I cannot simplify more than this. These are the heights. The first chapter is done. Now, before your exam, you can revise the entire chapter, I guess, in just 2 minutes or maximum 3 minutes. You can revise the entire chapter. Now, any question coming on this chapter, you can answer it. You can answer it. Now, let me teach you one more chapter, trimethoprim, because these two are always used in combination. So, let me teach you one more chapter. Then we will do questions on these two chapters. Then come on the third chapter. Everyone, give me a thumbs up. Shall I start the second chapter, trimethoprim? I'm starting the second chapter, trimethoprim. The first line in the introduction I have written, it is never used alone. So trimethoprim is always used with sulfonamide. And the combination is known as cotrimoxazole. Now I have told you the classification of sulfonamide. Now in sulfonamide they are short acting, intermediate acting, long acting. So कौन से वाले के साथ mix करोगे? With which sulfonamide you would like to mix the trimethoprim? We mix the trimethoprim with intermediate one. If you know the classification, intermediate में एक ही था. It is sulfamethoxazole. So we mix the trimethoprim with one of the sulfonamide which is intermediate acting and it is sulfamethoxazole, to be very specific. Sulfonamide तो इतने सारे हैं. Trimethoprim, there is no classification. You got my point? So sulfonamide plus trimethoprim is equal to cotrimoxazole or also known as Septron. पहला group, right? Sulfonamide have classification. They are long acting, they are intermediate acting, they are short acting, they are topical, they are special. But trimethoprim have no classification. It is only one drug, trimethoprim itself. So I'm saying the combination. So this question should come to your mind that trimethoprim is combined with which of them? So my answer is intermediate. So trimethoprim is combined with intermediate sulfonamide, which is sulfamethoxazole. Only one intermediate is there. So sulfamethoxazole के साथ ही combine करेंगे. You got my point? What is the combination ratio? You will mix them equal. How much you will mix them? So sulfonamide is to trimethoprim. We take 5 is to 1. So 5 times we will take sulfonamide. Always, it is a rule. So take 5 milligram of sulfonamide and 1 milligram of trimethoprim. So this combination is known as cotrimoxazole. Everyone give me a thumbs up. So 5 is to 1 is the answer. 5 is to 1. We mix them. So we make a tablet. In the tablet, there are two things. There is 5 times sulfonamide and 1 time trimethoprim. So this is 5 is to 1. So someone is taking this tablet by mouth. Just suppose I am the patient, I'm having some infection, RTI, UTI, and I'm taking this tablet as a treatment. So once I take the once I take the tablet of cotrimoxazole, so after going inside the mouth, esophagus, intestine, it will get absorbed and it will reach the blood. In the blood, the ratio of sulfonamide and trimethoprim become 20 is to 1. So the person take it in 5 is to 1, but after going in blood, it will become 20 is to 1, right? The reason is why it happens. The reason is difference in volume of distribution. So trimethoprim remain in the blood only. Because most of the trimethoprim enters in the tissue and sulfonamide remains in the blood only. So that's why the ratio changes after going inside the body. Give me a thumbs up. So what is the ratio? If you ask the ratio in which sulfonamide and trimethoprim is mixed. So the ratio, the answer, if we take them in 5 is to 1, but after going in the blood, it becomes 20 is to 1. So the two answers are in front of you. What's the relevance of 5 is to 1? What is the relevance of 20 is to 1? Everyone give me a thumbs up. What is 5 is to 1? What is 20 is to 1? Right. So why it is happening? The answer is volume of distribution. Right. Why we are doing this combination? The next question. Why we are doing this combination? We are doing this combination because of the synergistic action. If we are using individual drug, okay, I'm giving only sulfonamide to a patient, it will bacteriostatic. It will not kill the bacteria but inhibit the growth of the bacteria. If I give only trimethoprim to a patient, again it is also bacteriostatic. It will not kill the bacteria. It will only inhibit the growth of the bacteria. But if I'm giving the combination, that is, if I'm giving the cotrimoxazole, it is bactericidal. It will kill the bacteria. This is known as synergistic action. This is known as synergistic action. Synergistic action means they are exacerbated. So bacteriostatic plus bacteriostatic will become bactericidal. So you have to say all these things. These all are MCQs I will show you right now. So it is the synergistic action. The individual drug is bacteriostatic, but the combination becomes cidal. The combination becomes cidal. You got my point? So this is all introduction. In the introduction, write down the combination. In the combination, tell me the exact sulfonamide with which we are combining trimethoprim. So the name is intermediate one. That is sulfomethoxazole. Not short acting, not long acting, not topical. It is the intermediate one. Sulfomethoxazole. Right? Why we are doing this? Because of the synergistic action. Individual drug is bacteriostatic, but the combination is cidal. What is the ratio? We give them in 5 is to 1, but after going in the body, it becomes 20 is to 1. 5 and 20 is the sulfonamide, and 1 is always trimethoprim. So ulta mat kar dena, right? If I ask you the ratio, now read your question. In the exam, if S is to T is asked or T is to S is asked, what is asked in your exam? So if you ask S is to T, my answer is 5 is to 1. If you ask T is to 1, my answer is 1 is to 5. So depending on that, answer can vary. So please remember, sulfonamide is more than trimethoprim. Spectrum is broad. Don't learn the name of the bacteria here. Just learn broad spectrum, acting on all bacteria. Mechanism of action, I already taught you. I already taught you mechanism of action. Say yes or no. So the two drugs are used in combination. The combination is known as cotri, right? In the synthesis of folic acid, PABA, you can see this is PABA, para-amino-benzoic acid, get converted into dihydrofolic acid, and dihydrofolic acid converted into tetrahydrofolic acid. And this tetrahydrofolic acid is the main folic acid. And this is required for DNA synthesis, right? Now, two enzymes are required. The first enzyme is folate synthetase, which converts PABA into DHFA, dihydrofolic acid, and the second enzyme is folate reductase. ये folate synthetase है, ये folate reductase है. Actually, dihydrofolate reductase है, say DHFR. One is folate synthetase, the second is folate reductase. So dihydrofolate reductase. Now the two drugs. The first drug is sulfonamide. It inhibits the first enzyme. The second drug, trimethoprim, it inhibits the second enzyme. So ultimately, both of them are inhibiting tetrahydrofolate synthetase. Sulfonamide inhibiting the conversion of PABA to DHFA, and trimethoprim inhibit the conversion of DHFA to THFA. Ultimately, THFA is not formed, DNA is not formed. Both of them are nucleic acid synthesis inhibitor, but indirect one. They are not inhibiting directly DNA synthesis. They are inhibiting DNA synthesis indirectly by inhibiting folic acid. Because for the synthesis of DNA, folic acid is required. तो डायरेक्टली ये दोनों डीएनए के सिंथेसिस को इनहिबिट नहीं कर रही हैं. डीएनए के सिंथेसिस के लिए हमें फॉलिक एसिड चाहिए. ये दोनों की दोनों ड्रग फॉलिक एसिड के सिंथेसिस को इनहिबिट कर रही हैं. इसलिए बोथ ऑफ देम they are indirect nucleic acid synthesis inhibitors. Give me a thumbs up. Yes, have you got it? Mariam, Amar, Manohar, have you got it? Avinash, Jobin, Sufi, give me a thumbs up. Are you people there? Are you awakened or sleeping? So what is the mechanism of action? Say trimethoprim inhibits the enzyme dihydrofolate reductase, DHFR. So dihydrofolic acid cannot be converted to tetrahydrofolic acid. So if tetrahydrofolic acid is not formed, folic acid is not formed, and DNA will not form. So that is the mechanism of action. Coming on adverse effects, right? Unfortunately, for adverse effects of trimethoprim, I don't have mnemonic. If you have mnemonic, if you can make your own mnemonic. So adverse effects are non-specific, the one nausea, vomiting, the non-specific one. After that, megaloblastic anemia you have to learn because of folate deficiency. It causes folate deficiency not only in bacteria, it causes folate deficiency in humans also. And because of folate deficiency in human, it can result in megaloblastic anemia. It results in bone marrow toxicity also. That results in pancytopenia. It causes hyperkalemia, that is potassium increase, and it is teratogenic. Never give trimethoprim to a pregnant lady. It is teratogenic for the fetus. Uses are same. Septron. Why the uses are same? Because Septron is the uses for cotrimoxazole and it contains both. It is the uses of the combination, no? That is sulfonamide and trimethoprim. दोनों के combination के uses है. The uses are common for both of them. See the summary. Everyone see the summary. I'm showing you the summary. Now tell me the last thing. Why sulfomethoxazole is combined with trimethoprim? Tell me 5 reasons. Tell me 5 reasons why we are doing this combination, the cotrimoxazole. And in cotrimoxazole, why we are combining only intermediate one. Intermediate acting, that is sulfomethoxazole with trimethoprim, not the short, not the long. Why? They all are sulfonamide now. Why we are combining? Because trimethoprim के T half के साथ सिर्फ यही मैच करता है, right? So both have same T half. So we should mix such drugs which have same T half. We cannot mix such drugs which have different T half. So with the T half of trimethoprim, only intermediate one is matching here. That is sulfomethoxazole. That is the reason. Both of them have same T half. The combination become bactericidal. Individual them are bacteriostatic, but the combination is a bactericidal, right? They are doing sequential blockage. That is, they are blocking the two enzymes in sequence for the synthesis of folic acid. Trimethoprim and sulfonamide. Sulfonamide is inhibiting the first enzyme folate synthetase and trimethoprim is inhibiting the second enzyme folate reductase. That is known as sequential blockage. We are giving them in 5:1, but after going in the body, they become 20:1 because of difference in their volume of distribution. And resistance is less common with the combination. If we give the combination, resistance is less common. Everyone give me a thumbs up. The second chapter is over. I am done with 2 chapters till now. Now you can revise the 2 chapters in just 5 minutes. And after that, we will do, okay, I don't have questions for that. Strange. I forgot to put questions here. Okay, let me check if I'm having questions anywhere. I will put the polls. And otherwise, I will start the third chapter, quinolones. I will start the third chapter, quinolones. Are you people with me? Can I continue? Can I continue? Everyone give me a thumbs up. Can we revise first 2 chapters? Would you help me in the revision? So the first 2 chapters are done, are sulfonamide and trimethoprim, right? Then I will start the third chapter, quinolone, right? Sulfonamide and trimethoprim is done. Everyone give me a thumbs up. So tell me the introduction. In the sulfonamide, write the introduction. Why it is known as sulfonamide? It is having a sulfona and amide group. In the benzene, sulfona group is on carbon 4, amide group is on carbon 1, right? In the trimethoprim, write down these both are always used in combination and the combination is known as cotrimoxazole, right? So they are used, they are combined in 5:1. So in tablet, they are in 5:1. But after going in blood, it will become 20:1. What is the reason for this? Amar, what is the reason? The reason why it is changing after going in the blood, the ratio is changing. The ratio is changing because of difference in volume of distribution of the two drugs, right? So always the more is sulfonamide. So if I say sulfonamide is to trimethoprim, so in the tablet it is 5:1. So 5 is sulfonamide and 1 is trimethoprim. And after going in the body, it becomes 20:1. So 20 is sulfonamide and 1 is trimethoprim. You got my point? So that is the thing. And the action is synergistic. What's the meaning of synergistic? If you give them individually, sulfonamide or trimethoprim, it is bacteriostatic. It is bacteriostatic. But if you give them in combination, that is cotrimoxazole, the combination is bactericidal. So individually they are bacteriostatic, but the combination is bactericidal. It kills the bacteria. This is the meaning of synergistic action. Give me a thumbs up. That is the meaning of the synergistic action. So introduction is over. Coming on the classification, we have done the classification. Sulfonamide are divided into 5 categories: short acting, intermediate acting, long acting, topical, and special. But trimethoprim don't have any classification. It is only one drug, trimethoprim. And here I am not repeating the classification. I guess everyone knows it. We have learned it well, and everyone knows it. The classification. Give me a thumbs up. Everyone, give me a thumbs up. Coming on the spectrum, both are broad spectrum, right? Broad spectrum here also, right? Broad spectrum here also, broad, right? Both of them are broad spectrum, right? What is the mechanism of action? They both block one enzyme. You know the sequence. So PABA, that is para-amino-benzoic acid, get converted to dihydrofolic acid, and dihydrofolic acid converted to tetrahydrofolic acid. For this, two enzymes are required for this conversion. For the first conversion, the enzyme is folate synthetase, and for the second conversion, it is folate reductase. Say it completely, dihydrofolate reductase. Now we are having two drugs. So the first drug, sulfonamide, is acting here, inhibiting this enzyme, inhibiting the conversion of PABA to DHFA. गलती से थोड़ा बहुत हो भी गया, तो the second drug is present. The second drug is trimethoprim, which is inhibiting the second enzyme, that is DHFR, and inhibiting the conversion of DHFA to THFA. This is known as sequential blockage. So ultimately, folic acid is not formed, so DNA will not form. So both of them, that is sulfonamide as well as trimethoprim, these are indirect DNA inhibitors. They are not inhibiting DNA directly. Indirectly, by inhibiting folic acid, they are inhibiting the DNA synthesis. You can see the mechanism of action. The first one is inhibiting folate synthetase. The second one is inhibiting folate reductase, dihydrofolate reductase. Give me a thumbs up. Coming on adverse effect. Compare the adverse effect. Here we are having a pneumonic ABC rash. Here we don't have any pneumonic. Unfortunately, you can make it, right? So what is the full form? So tell me the adverse effect and uses of here, and tell me the adverse effect and uses here. Who will help me? So tell me adverse and effect and uses, sulfonamide and trimethoprim. First tell me adverse effect of both, and then tell me the uses of both. Who will help me? Adverse effect. Here we are having a pneumonic ABC rash. राइट ए इज एप्लास्टिक अनीमिया, दैट इज पैनसाइटोपेनिया, वो यहाँ पे भी है पैनसाइटोपेनिया और एप्लास्टिक अनीमिया इज कॉमन, राइट. बी इज व्हाट इज बी, bilirubin displacement that leads to kernicterus, right, that is unique here, not there. Here the third is crystalluria, crystals in the urine, again it is unique. R is rash, rash is allergy, so rash you can write here also, rash allergy is common in both of them, right. A is acetylation, S is SLE, and H is hemolysis and G6PD deficiency, right. हियर रैश हो गया, एलर्जी हो गया, पैनसाइटोपिनिया हो गया. यहाँ मेन है हाइपरकैलेमिया. नंबर 1 हाइपरकैलेमिया एंड teratogenic and megaloblastic anemia. These three things are unique, and here these all are unique. So now the unique and two are common in both of them. You can learn like that. Coming on the uses are same. Here also the use is septron, and here also the use is septron, because septron is the uses of the combination, and combination contains both. So tell me the full form of septron. Who will tell me the full form of septron? S for STD, E for arthritis, P for pneumocystis carinii and jejuni, T for typhoid, R for RTI, A for acute UTI, and N for nocardia. So we are done with adverse effect and uses. Everyone give me a thumbs up. So I am done with the first two chapters. Do you have any doubt in the first two chapters, or shall I proceed ahead? So let me start the third chapter, or you want questions on it? If you want questions on it, I have to search. You have to give me a minute. I have to search for the questions. If you want it, you have to give me a minute. And I'm not sure whether I will be able to search it right now, yes or no. Just a second. So let me come here on the third chapter. Give me a minute. Let me search. If I'm available right now, I will launch the polls. But you have to give me a minute for that. Let me search on the Telegram if I'm having a file saved with me. If I'm having a file saved with me, I will show you the questions also. Questions of first two chapters, right? Just a second. One of the file is uploading. If it contains the question, I will launch the polls. If it don't contain the questions, we will do the questions next time, and we will move directly on the chapter number 3, that is quinolones. But I want you to solve the questions so that you will have an overview that from which portion the questions are already asked in the previous year question papers. So, okay. Yes, so I'm having questions with me. So give me a minute to launch this file there. Would you allow me? I'm sorry, I know it's taking time, but give me a minute to just, it will take hardly few minutes. So have patience. Okay. So here we will find the file, and I will open that file. Just a second, it will get uploaded in a minute. I will open it.
We are seeing the gallbladder here. Okay. Now here, that is the groove for inferior vena cava. Inferior vena cava is here. So inferior vena cava and below gallbladder. Okay. So now we're going to draw one imaginary line connecting the fossa of gallbladder to the groove of IVC. Now, if you connect one line, yes, that line divide, that is a cantilevers line, dividing the liver into, yes, the functional right lobe and the functional left lobe. Okay.
Okay, so let me show you the questions of the first two chapters. I guess you have done the first two chapters. Now let's do the questions of the first two chapters. Okay, so can you tell me the answer? Can you see this now? Can you see this? I guess everyone can see this. It is on the screen. So can you tell me the answer? We have completed first two chapters, sulfonamide and trimethoprim. Both are completed. So this is the first question in front of you. Can you tell me the answer of this question? What is happening? Just a second. I don't know why I unable to use my pen. What happened to my pen? Okay, now I will be. Huh. Which is the longest acting sulfonamide? I have told you the classification of sulfonamide. The long acting, intermediate acting, short acting, topical and special. Who will tell me the answer? The longest acting, you know the answer. Is it sulfadiazine or doxil or methoxazole or mathizole? Who will tell me the answer? Amar, Madmix, anyone, Mariam, Manohar. Who is the longest acting among them? Can you see the question? So longest acting, yes, the correct answer is sulfadoxin. The doxin is the longest acting. Diazine is a short acting. Diazine is short acting. Doxin is long acting. Yes, very good, Amar. The correct answer here is B. You are absolutely right. Okay. This is the second question in front of you. What is the mechanism of action of sulfonamide? Read the four options. There's a question from previous year papers of NEET PG. What is the mechanism of action of sulfonamide? Can you tell me the answer? What's the mechanism of action? Does it inhibit cell wall synthesis in the bacteria? Does it inhibits the translocation of mRNA? Does it inhibit folate synthesis in the bacteria, or does it inhibits bacterial respiration? Very good, Amar. So it inhibits folate synthesis. I want everyone to participate. Very good, Kishore. Very good. So the correct answer here is C. It inhibits folate synthesis. And which enzyme? Farhad, which enzyme? Which enzyme? Tell me exact enzyme. If I ask is exact enzyme, the answer is folate synthesis. Right? In the folate synthesis, the enzyme is folate synthesis. Very good. Last night, Farhad, very good. The correct answer here is C. The next question is in front of you. Sulfonamide injection causes decrease in folic acid bind. Is it a competitive inhibition, non-competitive inhibition, uncompetitive inhibition, or allosteric inhibition? You know, sulfonamide is competing with PABA for inhibiting the folate synthesis, for binding with folate synthesis. Okay. If you have confusion in this question, okay, let me tell you. This is PABA. See, I have told you PABA get converted into dihydrofolate synthetase, and dihydrofolate synthetase get converted to tetrahydrofolate synthetase. We all know that, right? The first enzyme is folate synthetase. The second enzyme is folate reductase, dihydrofolate reductase. Now this is let me draw sulfonamide. Just suppose this is a molecule of sulfonamide, right? This is sulfonamide. Just suppose this is happening inside the bacteria. This is happening. Let me draw the cell of the bacteria. This is happening inside the cell of the bacteria. And this bacteria, I am the patient. This bacteria is present inside me. This is the bacteria, and this bacteria is present inside me. I am the patient. I am having infection of this bacteria. You are the doctor. You prescribe me that ma'am, you take sulfonamide tablet, and that sulfonamide tablet will kill the bacteria present inside you, and you will be all right. That is the treatment of your disease, whatever disease I am having, right? So I'm taking sulfonamide tablet. So the tablet is going in the mouth, esophagus, stomach, intestine, getting absorbed, reaching in the blood. From the blood, this tablet, the sulfonamide molecule is entering inside the bacteria and the blood. It is entering inside the bacteria and the blood. Now sulfonamide is also present here, and PABA is also present. So we want, so there is a competition between the two, sulfonamide and PABA. See, this is a molecule of PABA, and this is a molecule of sulfonamide. Both are competing with each other that who will go to the folate synthesis. Who will go to the folate synthesis? Actually, this sulfonamide, listen my words, this sulfonamide is structurally similar to PABA. एकदम similar है. इस FS मतलब folate synthesis को बेवकूफ बनाने के लिए we want to fool this folate synthesis. We want to make him fool, right? So that we have make sulfonamide a drug which is exactly same that of PABA. So this folate synthesis will think that this is PABA, right? So there's a competition between the two, right? So this sulfonamide will bind with the folate synthetase, and once it bind, folate synthetase will come to know nahi ki ye paba nahi hai, this is not paba, I got full, and once it bind, it will be inhibited. So this is the complete mechanism, right? You got my point. So the competition is, it is, the inhibition is competitive because there is a competition between sulfonamide and paba, that who will bind with folate synthetase, right? If PABA is binding, it is normal mechanism. It will get converted to DHFA and THFA. But if sulfonamide will bind with the folate synthesis, it will be inhibited. So we, to make sure that folate synthesis bind with sulfonamide, not with PABA, the structure of the both is two. We make sulfonamide tablet the same structure as that of PABA. So the correct answer here is A. Everyone got it? Yes, everyone is right. Kishore, Amar, last night, everyone is right. The next question is in front of you. This also, I guess, you will not be able to solve. Okay. Again, let me tell you one mechanism. One thing, then I will launch this question. Listen first. What is the mechanism? Again, let me write it once more. PABA get converted to dihydrofolic acid, and it get converted to tetrahydrofolic acid. I told you this tetrahydrofolic acid is required for DNA synthesis. Have I told you? Yes or no? Have I told you? No one of you have asked me, ma'am, why? Why tetrahydrofolic synthesis is required for DNA? At which step we require it? So DNA have four things inside that. What are the four things present in DNA? Adenine, guanine, cytosine, and thymidine. DNA is made up of these four nucleotides. Have you ever thought how thymidine is formed? How thymidine is formed? Thymidine is formed from uracil. Uracil get converted to thymidine, and for this conversion, you require this folic acid. If folic acid is present, uracil will get converted into thymidine and DNA can be formed. If folic acid is absent, uracil will not convert into thymidine, and the thymidine will not form, DNA will not form. You got my point. So folic acid is required for thymidine synthesis in DNA. You got my point. Now read the question. Now I guess you will be able to solve it. Now read the question. Thymidine is responsible for resistance for which antibiotic? Just suppose you are giving one of these antibiotic. Along with the antibiotic, you are giving thymidine also. So the antibiotic will not work. Which is that? Which is among that? Which antibiotic? So of course the answer is sulfonamide, because you are giving sulfonamide basically. So by giving sulfonamide, you are making sure that bacteria is not making tetrahydrofolic acid. So that in absence of folic acid, thymidine is not synthesized, and since thymidine is absent, so DNA will not be synthesized and the bacteria will be killed. You are making sure that. But along with sulfonamide, if you are giving separately thymidine tablet, तो bacteria will not kill. Bacteria यहाँ से तो thymidine नहीं बनाएगा, लेकिन तुमने अलग से दे दिया, so antibiotic will not work. So it will create the resistance to the antibiotic. You got my point? Question is little, but it is complicated. You got my point? Everyone give me a thumbs up. Yes, Kishore Amar, the answer is right, sulfonamide, but you got the mechanism behind that. You got the mechanism behind that. The next question is in front of you. All of the following are topical sulfonamide except. You know the name of three topical sulfonamide. Tell me which is not a topical sulfonamide. I'm asking except. Please mind the question, it is except. So the four options are acetamide, sulfadiazine, silver sulfadiazine, and mephenite. What is the answer? What is the answer here? Yes, you are right. So correct answer here is definitely sulfadiazine. If I say only sulfadiazine, it is short acting. But if I add silver in them, silver sulfadiazine, it will become topical. It will become topical. So this one is short acting, not topical. If only sulfadiazine is there. So correct answer here is B. You got my point? So correct answer here is B. The next question is in front of you. Which of the following is a topical sulfonamide? Which of the following is topical? I'm asking, it's very easy question. It's very easy question. Which of the following is topical? So tell me the answer. Is it sulfadoxin? Is it sulfamethoparazine? Or is it none? Or is it mephenite? Is it mephenite? So mephenide is the answer, right? So mephenide is the topical one. You know the three topical one. What are the three topical one? It is sulfacetamide, it is silver sulfadiazine, and mephenide. These are the three topical one. Mephenide is one of them. So correct answer here is mephenide. You all are right. Which of the following is the side effect of sulfonamide? You know the mnemonic. What is the side effect mnemonic? The mnemonic is ABC rash. Apply the mnemonic and see which of them is coming in this mnemonic. Which of them is the side effect of sulfonamide? Is it constipation coming here? C. C is crystalluria, not constipation. No, it is not the answer. Joint pain coming in the mnemonic? No. Crystalluria? Yes. Here C is crystalluria. So my answer is crystalluria. Hyperkalemia is a side effect of second drug, that is trimethoprim, but not sulfonamide. So I will go with C. Yes, last night Amar Kishore absolutely right. The correct answer here is C. Shall we move ahead? This is the next question in front of you. So in unconjugated hyperbilirubinemia, the risk of kernicterus increases with which drug? Which of the following drug causes risk of kernicterus in a child? So apply the mnemonic. ABC rash. ABC rash में what is B? What is B? B is bilirubin displacement. By displacing bilirubin from the albumin, the free bilirubin will enter in the brain and damage the brain and causes kernicterus. So the drug is sulfonamide. Sulfonamide is the answer, and you all are right. Sulfonamide causes kernicterus. Sulfonamide, the kernicterus is a side effect of sulfonamide, not of other drugs. So the correct answer here is D. Not C last night. C is ampicillin. Penicillin का side effect नहीं है ये. It is a side effect of sulfonamide. You know, in the mnemonic of the side effect of sulfonamide, B is bilirubin displacement. So the correct answer is D. You got my point? So we are done with the questions based on this chapter. Let me come on the questions of the second chapter. First chapter की questions हो गए. So second chapter trimethoprim पे कुछ questions. We have done the revision. We have already done the revision. Now these are the questions of the second chapter. Okay. Can you tell me the answer? In cotrimoxazole, sulfonamide and trimethoprim, both are mixed in what ratio? Can you tell me the answer? The four options are in front of you. Are they mixed in 2 is to 1? Are they mixed in 1 is to 1? Are they mixed in 5 is to 1? Or are they mixed in 1 is to 5? Now don't get confused in 5 is to 1 and 1 is to 5. Listen, in the question what is asked? Sulfo versus tri. So sulfomethoxazole is to trimethoprim. What is the answer? What is the answer now? Yes, Kishore, Amar, absolutely right. The answer is C. It is 5 is to 1. So Amar, Kishore, if I change the question and if I change the sequence, if sulfomethoxazole or trimethoprim का sequence I change, trimethoprim and sulfomethoxazole कर दूं, तो answer will become 1 is to 5. You got my point? So depending on the sequence what I am asking. So correct answer here is C. Right? Can you tell me the answer of this question? Can you people tell me the answer of this question? So trimethoprim acts by which mechanism? Can you tell me the mechanism of action of trimethoprim? Yes, Kishore, absolutely right. Can you tell me what is the mechanism? It inhibits which enzyme? It inhibits which enzyme? Does it inhibit DHFR? Does it inhibit protein synthesis in the bacteria? Does it inhibit cell wall synthesis in the bacteria? Or does it inhibit cell membrane? So it inhibits an enzyme. The name of the enzyme is dihydrofolate reductase. So the correct answer here is A. The correct answer here is A. We are done with 2 chapters till now. Yes, Wasim, absolutely right. Yes, Manohar. So we are done the 2 chapters till now. The sulfonamide and trimethoprim. Let's start chapter number 3, quinolones. So start filling your table. Start filling your table. I'm starting the third chapter, quinolones. So till now I taught you these 2 chapters. Now these 2 were inhibiting nucleic acid. They were inhibiting DNA, but these 2 were indirect inhibitors because both of them were inhibiting folic acid synthesis, and folic acid is required for thymidine synthesis in the DNA. So if folic acid is absent, thymidine will not form, so DNA will not form. So both of them were indirect inhibitors of DNA. And now I'm starting the third chapter, quinolone. Quinolone is a direct inhibitor of DNA. So let me start chapter number 3, quinolones. Are you people with me? So start writing. Start writing. Quinolone is known as quinolone because in the structure, this is the quinolone ring. Can you see this is quinolone? This ring is known as quinolone, the 2 benzenes, right? And with this structure, it is a quinolone ring. The ring is known as quinolone. That's why it is known as quinolone. Give me a thumbs up. So only the first time quinolones were launched having only quinolone ring, that is nalidixic acid, the first member. The first member is the nalidixic acid, having only quinolone, but it is not very active. It is having a very narrow spectrum. So we add fluorine on carbon number 7. Can you see? This is fluorine. On carbon number 6, we add fluorine. We have added fluorine. Now these are known as fluoroquinolones. So fluoroquinolones are generated from quinolones. We have generated fluoroquinolones by adding fluorine to increase the activity. Give me a thumbs up. Shall we proceed ahead? Shall we proceed ahead? So fluoroquinolones have generated. So coming on the classification. Introduction is over. Coming on the classification. In the classification, let me tell you there are 4 generations. First generation, second generation, third generation, fourth generation. What do you mean by generation? First generation, second, third, fourth. What do you mean by that? So the generation is based on the spectrum. The first generation, The first generation acts only against gram-negative bacteria. Only against gram-negative bacteria. It kills only gram-negative bacteria, no one else. None of the gram-positive bacteria, right? So the two members are nalidixic acid and oxanilic acid. So they are narrow spectrum. The first generation was the first coming in the market, and it was very narrow spectrum. It kills only gram-negative bacteria, and two members are available in this category: nalidixic acid and oxanilic acid. Then we have generated second generation. Humans have created second generation. It is having expanded gram negative. It is also gram negative, but यहाँ पे gram negative भी बहुत narrow था. Very few gram negative were killed. Gram negative भी पूरे नहीं मर रहे थे, right? Gram negative were killing only few. That is moderate or mild gram negative activity. Here the gram negative activity at least expanded. So a little bit expansion in the spectrum. Still gram positive is zero, right? But at least gram negative is expanded, right? Here we are having four drugs, right? Two are class 1, two are class 2, right? If you don't want to learn class 1, class 2, it's okay. Four drugs are there: Norflox, Lomeflox, Ciproflox, and Oflox. Make a mnemonic and give it to me also. Nalco is the mnemonic. NLCO. It is Norflox, Lomeflox, Ciproflox, Oflox. So all of them are floxacin. Now we have added fluorine them. Right? In the first generation, only quinolones were there. There is no fluorine. But in the second generation, we have added fluorine in the quinolones. That's why all of them are floxacin. Floxacin means fluorinated. They all are fluorinated. That is second generation. So Norflox, Lomeflox, Ciproflox, Oflox, Nalco, NLCO. If you have some other better mnemonic, please write down. I will tell everyone. So Nalco is the mnemonic, right? Second generation ho gaya. Coming on third generation. In the third generation, expanded gram negative to है like second generation, but additionally a little bit gram positive activity is also there. So they kill some gram positive also along with all gram negative. So we have expanded further. So here we are having seven drugs. We are having seven drugs now here in this category. So levoflox, वहां पे लोमे था, L was lome. Here L is levo. Levoflox, sparflox, right? Gatiflox, P-flox, Temaflox, Tosuflox, and Moxiflox. Please help me with the mnemonic. I'm not having it. So please help me with the mnemonic. Can you make it? Can you make it, someone? Please make mnemonic of these first letter. So it is double T, there is one M, there is one P, LSG, 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 P, T, T, M. Right? So please make some mnemonic. It is Levoflox, Sparflox, Gatiflox, P-flox, Temaflox, Tosuflox, Moxiflox. So these are the drugs in the third generation. Coming on the last fourth generation. In the fourth generation, complete gram positive, complete gram negative along with anaerobic. So that is the broadest one, the best one, the broadest one. All bacteria are killed. So there are six drugs in this category. Trovaflox, वहां पे भी दो टी थे, लेकिन one was टीमा, one was कासू. यहाँ पे Trovaflox, Fleroflox, Gamiflox, Pruliflox, Sitaflox, and Clina. So what are the drugs? Clinaflox, Sitaflox, Pruliflox, Gamiflox, Flerusacin, and Trovaflox. So these are the drugs you have to learn. That is the fourth generation. Give me a thumbs up if you got it. So tell me what is the difference between first, second, third, and fourth generation. It is based on the spectrum. So can someone help me with the spectrum? First generation acts only against gram negative and that to moderate activity, right? Second, also against gram negative only, but that is expanded gram negative, no gram positive till now. In third generation, expanded gram negative to है, but expanded gram positive भी आ गया, right? Gram positive भी आ गया. In fourth generation, expanded gram negative to है, expanded gram positive तो है, साथ में anaerobics भी आ गया. So this one is the broadest. Now I suggest you please learn the drugs inside each category. In the first category, two drugs are there. That is nalidixic acid and oxalic acid. Only two which are non-fluorinated. Rest all will be fluorinated. So tell me the fluorination. Right. Here four drugs are there. Nalco was the name of it. Nalco. So that is Norflox, Lemiflox, Ciproflox, and Oflox. Right. In the third category, LSG, TTPM. Right. This was the mnemonic. So PM, TT, LSG. Make some mnemonic. Right. So it is Levoflox, Sparflox, Gatiflox, Truvaflox, Tamiflox, P-flox, Moxiflox. Right. In the fourth generation, I don't remember the name, but make some mnemonic and learn it. This one is the most important since it is the broadest one. So please learn the make a mnemonic and learn the name of the drugs. So that's how I can help you in simplifying the classification. This is the classification along with spectrum. So these two drugs acts against only gram negative. These four also acts against gram negative but extended spectrum. These drugs acts against gram negative also, gram positive also, and these one act against gram negative also, gram positive also, andropic also. So spectrum is also done. Everyone give me a thumbs up. So we are done with spectrum also. Coming on mechanism of action directly. Shall I start? Kishore, Manohar. Shall I start the mechanism of action of quinolones? Shall I start? How replication, DNA replication takes place. See, this is a cell. Let me draw a cell of a bacteria. Let me draw the nucleus. Let me draw the double-stranded DNA. This is double-stranded DNA. Tell me how replication takes place. If this cell wants to divide into two cells, how does it will happen? How DNA replication take place? So you will say, ma'am, the double-stranded DNA. This is the nucleus. Inside the nucleus, the double-stranded DNA is there. First, the two strands will separate from each other like this. One of the strand is leading, one of the strand is lagging. You know that. So in both of them, the enzyme DNA polymerase will come and it contains nucleotides on them. Adenine, guanine, cytosine, thymidine. So corresponding to two complementary templates will be formed. You know that, right? Corresponding complement templates will be formed. So A will form bond with C, and guanine will form with C, and adenine with thymidine. You know the complete story, right? So like this complement. So out of the two, four strands are there, and they will separate. This is the complete story. Say yes or no. Say yes or no. This is the complete story. Yes or no? So the first step is to separate the two strands of the DNA. Have you ever thought? This is the double-stranded DNA. The first step is to separate. Then the complementary strand will form here. Then the complementary strands will be formed on the leading and lagging. But how the two are separated? My question is, they are double-stranded DNA. In the double-stranded DNA, how the leading and lagging they got separated? This step is known as unwinding. Unwinding. This step is known as unwinding. So the DNAs get unwinded, and after that complementary strand is formed. I am not interested in that. I am interested in unwinding step. So are you agree with my statement that if you want to do DNA replication, if any cell want to replicate the DNA, the first step the cell should do unwinding. If unwinding is not possible, replication is not possible. The first thing you have to separate the two strands. Is it? Is it? Yes or no? So how unwinding takes place? Which enzyme is responsible for unwinding? For unwinding, two enzymes are responsible. If we talk about gram-negative bacteria, the enzyme is DNA gyrase. And if we talk about gram-positive bacteria, the enzyme is topoisomerase 4. Both of these enzymes are doing the same function. They are doing unwinding. They are doing unwinding. So again, I am saying this is the double-stranded DNA. See, let me draw the double-stranded DNA like this, right? And unwinding like this. So they will get separated like this, like this. This is done by an enzyme. The name of the enzyme is DNA gyrase. If it is a gram-negative bacteria, gyrase. And the name of the same enzyme is DNA topoisomerase 4 if it is a gram-positive bacteria. So this step, the unwinding, this is known as unwinding. Unwinding is done by these two enzymes, right? And I am teaching you quinolones. Quinolones inhibit these enzymes. So if someone is taking quinolone, these two enzymes will be inhibited. So unwinding is not possible. So DNA replication is not possible. So these are direct inhibitors of DNA replication, not indirect. Not indirect like sulfonamide and trimethoprim. Sulfonamide and trimethoprim were inhibiting DNA replication by inhibiting folic acid synthesis, not directly. But they are directly inhibiting the unwinding step of the DNA replication. That's why these are direct inhibitors. Give me a thumbs up if you got it. Everyone give me a thumbs up. Say yes. So that is the unwinding. This is how unwinding works. So unwinding step is this and two enzymes are required. You know the name of the two enzymes. So can you see this diagram? Can you see this is double-stranded DNA? Here I am drawing. See, this is double-stranded DNA. If you want to replicate it, this is the enzyme coming. The name of the enzyme is either DNA gyrase or topoisomerase 4, depending gram positive or gram negative. What this enzyme is doing? Separating the two steps to two strands. One is leading and one is lagging. So these two are separated. Now, after this, another enzyme that is DNA polymerase will come and form the complementary strand here also and form the complementary strand here also. I'm not interested in this portion, the complementary strand formation. I'm interested in separation. The separation is known as unwinding. Unwinding. You got my point? Unwinding. So how exactly unwinding is done? How exactly? So as I've told you, the name of the enzyme required is DNA gyrase. In gram-negative bacteria, it is DNA gyrase. Say yes or no. So DNA gyrase have two units. Let me draw a double-stranded bacteria. This is double-stranded bacteria. So unwinding actually hota kaise hai? This get converted into this. This is known as unwinding. So how does it happen? What is the exact mechanism? I know DNA gyrase is doing it, but how? How? Tell me the details. How? DNA gyrase or topoisomerase 4, anyone. Both of them are doing the same job. How? So DNA gyrase have two unit, unit A and unit B. Right? So what does unit A do? What does unit B and A? So unit B comes, give a nick at multiple places. You know nick means cut. Nick का मतलब होता है cut. Gives a nick or cut at multiple places. That is B is cutting. It is cutting the DNA at multiple places. So multiple places पे cut हो गया. Cut होने के बाद उसको unwind करो. You know unwinding क्या होता है? So just suppose I am having a paper. Okay, give me a minute. So I'm having a paper with me, right? So DNA is like a strip, right? So it is folded this direction. But if I open it and fold it in opposite direction, that is unwinding. Now it will become straight. तो जितना इधर का stress था उतना उधर से equal हो गया. Now it is becoming straight. So DNA is like this. So give opposite coiling so that it becomes straight. You got my point? So this is known as uncoiling. This is known as unwinding or uncoiling. So first B will come, give cut at multiple places. Then A will come. A will do the negative coiling. So if DNA is folded in this direction, A will fold in opposite direction. If DNA is folded in that direction, this fold in opposite direction. So that DNA becomes straight. That is known as uncoiling. That is known as unfolding, uncoiling, whatever, negative coiling. So uncoiling is done by A, right? अब uncoiling होके वो straight हो गया, right? It becomes straight. Now again B will come and again it will seal it. तो cutting और sealing वापस उसको जोड़ देगा. So cutting और sealing का काम B का है. पहले B कट लगाएगा, A आएगा, नेगेटिव कॉइलिंग करेगा और B उसको सील कर देगा. So cutting is done by B, right? Sealing in the end is also done by. काटने और सीलने का काम B का है. Cutting and sealing is done by unit B, and unit A is the main unit which is causing uncoiling. So my question to you: quinolones inhibit which unit, A or B? Quinolones inhibit B. Quinolones don't inhibit the main unit A. Quinolones exactly, okay, it inhibits DNA gyrase or topoisomerase 4. लेकिन which unit, to be very specific, which unit of these enzymes, unit A or unit B? They inhibit unit B, which is doing cutting and sealing. So cutting and sealing is not possible, without which unwinding is not possible. So DNA is unable to unwind. Give me a thumbs up. Everyone give me a thumbs up. Everyone. So can you see here cutting and sealing is shown. So first B is coming, giving a cut here. Then A is coming, giving negative coil, and then B is coming and doing the resealing again. So that is the thing. So DNA gyrase have two units, unit A and unit B. Okay, मैंने उल्टा बोला. I am sorry for my mistake. It is the unit A which is doing cutting and sealing. It is the unit A. First it is coming, giving a cut, right? And it is the unit A. Again, it is sealing, right? And unit B is the main B unit. Unit B is the main unit which is introducing negative supercoil. That is unwinding. So unwinding, right? So that is normally happens, and this is how unwinding of the two strands occurs. Now fluoroquinolones bind to DNA gyrase enzyme, and fluoroquinolones inhibit the cutting sealing wala unit. What is the unit? Unit A. So unit A seal. So cutting and sealing is not possible. So it interferes with cutting and sealing function. That is, it inhibits the unit A, not unit B. Right? I have done the mistake previously, so I am correcting my mistake. I am correcting my mistake that there are two units, unit A, unit B. I am right in that. But unit A is doing the job of cutting and sealing. Unit B is the main unit which is introducing negative supercoil. And quinolones inhibit unit A, not B. I'm correcting my mistake. Please, everyone, listen. You got my point? You got my point? So this is how fluoroquinolones action. So this is the mechanism of action of fluoroquinolones. So can you summarize me fluoroquinolones or quinolones का mechanism of action क्या है? Can anyone tell me in one word if you want to say they inhibit an enzyme? The name of the enzyme is DNA gyrase in gram negative bacteria, and the name of the enzyme is topoisomerase 4 in gram positive bacteria. So this is the name of the enzyme is gram negative bacteria. This is the name of the enzyme is gram positive bacteria. Both the enzymes are doing same job. They are causing unbinding of DNA. So unbinding of DNA, the two strand separation will not possible. So DNA replication is not possible. So they are inhibiting the replication of the DNA basically. And exactly to be very specific, they have these enzymes have two subunit, unit A and unit B. So quinolones inhibit unit A, not the unit B. And unit A is required for cutting and sealing. And unit B is causing negative supercoiling, but they inhibit unit A, not B. So that is the summary. Everyone give me a thumbs up. Kishore, Amar, have you got it? Saman, have you got it? So shall I proceed ahead? So coming on the adverse effect. Coming on the adverse effect. Mechanism of action is done. Now coming on the adverse effect. In the adverse effect, GIT most commonly affected. GIT is most, I don't have mnemonic, but we will try to make so, right? GIT में nausea, vomiting, diarrhea कुछ भी हो सकता है. CNS is also affected due to GABA antagonistic action. So CNS में patient have headache, dizziness, sleep disorders, mood disturbances, changes. Bone soft tissue is also affected. In bone soft tissue, patient have tendonitis, inflammation of the tendon. That's why it is contraindicated in children. Don't give it in children. That is bone soft tissue. उसके अलावा skin. Talk about skin. Skin में phototoxicity will be there. I don't have diagram. The complete sunburn reaction will be there. So phototoxicity is caused only by three. Only by three. You have to learn the names. इसमें बहुत MCQs आते हैं. I will launch the polls. Lomeflox, Sparflox, Pflox. Lomeflox, Sparflox, Pflox. So only these three are required. Lomeflox, Sparflox, and Pflox. That is phototoxicity in the skin. Right? They cause LSP. You have to learn the mnemonic L followed by S followed by P, right? That is the three which causes phototoxicity. Coming on the heart. In the heart, they cause torsitis d pointers, right? So they cause torsitis. Only three causes: Sparflox, Gattiflox, and Moxiflox. Not all. They causes torsitis d pointers, and they are teratogenic. So learn the six systems. What are the six systems? GIT, brain, bone soft tissue, heart, skin, and pregnancy. So what I have told you, start with GIT, come on CNS, then come on bone and soft tissue. Along with CNS, learn CVS also. CNS, CVS, you can say together. GIT, CNS, CVS, bone soft tissue, skin, and pregnancy. In skin and pregnancy, right? So tell me the side effects inside them. In the GIT, it's diarrhea, vomiting, nausea. In CNS, it is sleep disturbances, mood disorders, seizures. In bone soft tissue, it is tendinitis. Tendinitis. In CNS, CVS, it is torsitis d pointis. You know what is torsitis d pointis. In the skin, it causes phototoxicity. And pregnancy, may it is teratogenic. Right? Now tell me the specific name which causes phototoxicity. Only three causes phototoxicity, not all. So the mnemonic is LSP. I have told you the mnemonic. The mnemonic is LSP. That is Lomeflox, Sparflox, and Pflox. Everyone give me a thumbs up. Someone, what you are asking, what is the cutting enzyme? Just now I taught you the cutting enzyme is the two. The cutting enzyme is the subunit A of DNA, guys. Subunit A. Cutting and sealing both the same. Cutting and sealing is done by subunit A of DNA gyrase. And unwinding is done by negative supercoiling is done by subunit B. If you are asking the subunits, this is the answer. Shall I proceed? Someone give me a thumbs up. So have you got it? So tell me the six side effects again. Will you try the six side effects? So GIT, CNS, CVS. Say together, right? After that, bone soft tissue and skin. Say together. ये दोनों साथ में याद आ जाएंगे. Skin and bone soft tissue. CNS, CVS, GIT, and in the end, say pregnancy. I don't have any mnemonic, but I guess it's simple. It's simple. So in GIT, you know it's nausea, diarrhea, vomiting, constipation. CNS, seizures, mood disorders, sleep disorders. CVS में specific है, torsitis d pointers. So be specific, torsitis d pointers. Bones of tissue में specific है, it is tendinitis. That's why contraindicated in children. Skin में specific है, phototoxicity. Pregnancy में specific है, teratogenic. Right? Now among these, learn the specific three who are causing phototoxicity. The mnemonic is LSP. वैसे तो torsitis d pointers की भी तीन specific हैं. You should learn that also. Which one? It is Sparflox, Gattiflox, and Moxiflox. Sparflox is common in both. Right? Give me a thumbs up. I tried best. Coming on uses. For users, I'm having a mnemonic for you. As I've told you, these are broad spectrum. These are broad spectrum. So everything is there in the uses. The mnemonic is 4G spectrum CT. 4G. What are the 4G? The 4G are gonorrhea. They are used in gonorrhea, gastroenteritis, gynecological infections, and gram-negative infections. The 4G. Right? Spectrum ka S is septicemia. They are drug of choice. They are given in septicemia. P is prophylaxis. But what do you mean by prophylaxis? Before surgery or before any surgery, we give prophylactic antibiotics. You may be knowing that. So they can be given as a prophylactic antibiotics before surgery, right? E for enterocolitis, that is diarrhea. C for chancroid, it is a type of STD, sexually transmitted disease. T for typhoid, R for RTI, U for UTI, M for meningitis, C for conjunctivitis, and T for tuberculosis. You got my point? You got my point? Say yes or no. So would you like to try? Let me try. It looks difficult, but we will try. 4G spectrum. Spectrum. CT. Writing mnemonic is the easiest thing. Saying the full form is the most difficult. Right? Mnemonic लिखना तो बहुत आसान है, लेकिन उसका full form सही से ही बोलना मुश्किल है. Right? You know 4Gs. What are 4Gs? I guess you know that. The 4Gs. Right? Spectrum का S is septicemia. P is prophylactic antibiotic. E is enterocolitis, right? That is diarrhea. C is chancroid, which is a type of STD. T is typhoid. R is RTI, respiratory tract infection. U is UTI, urinary tract infection. M is meningitis. M is meningitis. C is conjunctivitis, and T is tuberculosis. So two T are there, typhoid and TB. Everyone, give me a thumbs up. These are the uses of quinolones, which are broad spectrum, right? So that is the thing. Now there are a few one liners. Are you interested in the one liners? Yes, the 4G nausea, the 4G are gonorrhea, gastroenteritis, gynecological manifestations, infections, and gram-negative bacteria. See the full form. So that is the uses. We are done. So can you summarize the adverse effect and uses of quinolones? Can anyone help me with that? Adverse effect and uses, the two things. First, tell me the adverse effect. So adverse effect are six: the GIT, CNS, CVS, bone soft tissue, skin, and pregnancy. These are the six systems: GIT, CNS, CVS, bone soft tissue, skin, and pregnancy. So these are the adverse effect. We know that GIT में non-specific are there, diarrhea, vomiting, constipation. CNS में भी non-specific है. CVS में specific torsitis, D pointers. बोन्स ऑफ टिश्यू में स्पेसिफिक है टेंडेनाइटिस, स्किन में स्पेसिफिक है फोटोटॉक्सिसिटी, और प्रेगनेंसी में स्पेसिफिक है टेराटोजेनिक, राइट? यूजर्स, हु विल टेल मी द यूजर्स इज 4G spectrum CT. Who will tell me the answer? 4G. You know 4G. It is gonorrhea, it is gastroenteritis, gynecological infections, and gram-negative bacteria. Right? Spectrum का S is septicemia, prophylactic antibiotic, enterocolitis, chancroid. Two T's are there. One is typhoid, one is TB. Right? RTI, respiratory tract infection. UTI, urinary tract infection. Meningitis, conjunctivitis. I am done. Right? So adverse effects and uses are in front of you of the chapter quinolones. Shall I proceed? Now there are some one-liners on which many MCQs come. I'm telling you all the one-liners. Now tell me which is the most potent among the first generation. In the first generation, I told you four. Nalco. If you remember, Norflox, Lamiflox, Ciproflox, and Oflox. So among the first generation, Ciproflox is most potent, right? And which is the least potent? Norflox is the least potent. So Nalco में से most कौन है, least कौन है? Nalco में से most potent is Cipro and least potent is Norflox. So among the first generation, these are the two MCQs asked, right? Okay. Okay, just a second. Yeah, learn this page. So T-flox attains highest concentration in the CSF. That's why it is the preferred quinolone in meningitis. In meningitis, you want such a drug that can reach the CSF. And among all, T-flox has highest concentration in the CSF. That's why spectrum का M क्या है? 4G spectrum. स्पेक्ट्रम का M क्या है? स्पेक्ट्रम CT का M is meningitis. So it is given in meningitis. Now, which of them is given in meningitis? In the meningitis, we prefer P-flox. The reason it is having highest CSF concentration. Okay. Tell me the highest bioavailability and lowest bioavailability. The two drugs. The highest and lowest दोनों पे MCQ है. Highest 100% oral bioavailability is Levoflox and the lowest is Norflox. Levoflox and Norflox. Both bioavailability like you have to. Maximum plasma protein binding किसका है? The answer is Parflox. Highest first pass metabolism किसका है? The answer is Pflox. Longest acting कौन है? The answer is Parflox. So you have to learn all these, the one-liners: highest bioavailability, lowest bioavailability, highest plasma protein binding, highest first pass, the longest acting, maximum CSF concentration, right? Most potent for TB. Most potent for TB is Moxiflox, right? Okay. Moxiflox is unique that it is a strong activity for gram positive bacteria as compared to gram negative. All other have more activity for gram negative as compared to gram positive. But moxiflox is unique that it is having strong activity for positive as compared to negative, right? Phototoxicity तीन में होती है. I have told you LSP. Learn in the sequence only. So highest in Lomi, followed by SPAR, followed by P. That is phototoxicity, right? Okay, few more important points are there about the excretion. About the excretion, some of them are excreted via renal, that is kidney, and some of them are excreted via primarily excreted by these one are excreted by renal, these are non-renal. These are non-renal mechanism, right? So you have to learn, and Sparflox is 50-50. 50% renal, 50% fecal. So some of them are excreted in urine, that is renal excretion. Some of them are excreted in stools, feces, दैट इज नॉन रीनल एक्सक्रीशन. सो यू हैव टू लर्न द लिस्ट कि कौन से फीसेस में एक्सक्रीट होते हैं, कौन से यूरिन में एक्सक्रीट होते हैं. एंड स्पार्क फ्लॉक्स इज 50-50%. नो, सम ऑफ देम आर बैंड in India. They are banned. They are not available in market. They are 5 in number. They are banned. You should know the reason why they are banned. You should know that. So Tamiflox is banned because it causes immune hemolytic anemia. Grapaflox is banned because it causes cardiotoxicity. Trovaflox is banned because it causes hepatotoxicity. Clenaflox is banned because it causes photo, severe photo. ये सब severe कराते हैं. इतना severe that it is intolerable. That's why they are banned. And Gatiflox तो अभी अभी ban हुआ है. It is banned recently in India because of hyperglycemia, severe hyperglycemia. So the patient have diabetes or severe hyperglycemia. Give me a thumbs up. Give me a thumbs up. Drug-induced diabetes. So these 5 are banned. Now questions can be asked on any one-liner. I know learning one-liners are a little bit difficult, but if you try it, it is not that way. Right? I will launch the polls also in the form of the questions. You will be able to learn it. Right? So shall I continue? Shall I continue? So can you see the 3 chapters are completed from my side? I have completed 3 chapters till now. I have completed 3 chapters. The first chapter was sulfonamide. The second chapter is trimethoprim. The third chapter is quinolone. We have completed 3 chapters in antimicrobial drugs. All the 3 are nucleic acid synthesis inhibitors. The first 2 are indirect inhibitors and the third one is direct inhibitor. Right? So introduction to ठीक है. You should know classification. So sulfonamide का classification is based on duration of action. Short acting, intermediate acting, long acting, topical and special. Trimethoprim don't have any classification. Quinolone का classification is based on the spectrum. It is first generation, second generation, third generation, fourth generation. Right? So quinolone's का classification is based on the spectrum. First generation acts only against gram negative, moderate gram negative. Second generation extended gram negative. Third generation along with gram negative, gram positive also. And fourth generation along with gram negative, gram positive, anaerobics also. So that is the spectrum. Spectrum is very important. Inside each generation, you should know the name of the drugs. How many drugs are there? Name them, number them. कितने हैं बताओ. Right? Tell me the most important mechanism of action of all 3. Can you tell me the mechanism of action of the three drugs? Tell me the mechanism of action of sulfonamide. Tell me the mechanism of action of trimethoprim. Tell me the mechanism of action of quinolone. I know both or all the 3 are nucleic acid synthesis inhibitor, but tell me the exact step. Sulfonamide inhibit the enzyme folate synthetase so that it inhibits the synthesis of folic acid, tetrahydrofolic acid. Trimethoprim inhibit the enzyme folate reductase, that is dihydrofolate reductase. So again, it inhibits the tetrahydrofolic acid synthesis inhibition. So basically, both of them are sequential blockage, and they inhibit folic acid synthesis. So they indirectly inhibit DNA synthesis. That is sulfonamide and trimethoprim. What about quinolones? Quinolones inhibit 2 enzymes. Either they inhibit DNA gyrase if the bacteria is gram negative, or they inhibit topoisomerase 4 if the bacteria is gram positive. Both these enzymes are required for unbinding of the 2 strands, the leading and the lagging of the DNA. The first step is unbinding. तो unbinding कराने के काम आते हैं ये दोनों. In maybe they both these enzymes have unit A, unit B. So it is the unit A which is inhibited, not unit B. So nicking and sealing function is not done. So that is the specific mechanism of action of all 3. Give me a thumbs up. So if mechanism of action is done, tell me the adverse effect and uses of each of them. The adverse effect and uses are very, very, very important. So we will revise them once and then we will do MCQs based on the quinolones, right? So again, I'm just revising you again. Sulfonamide, trimethoprim, quinolone. The Tell me the adverse effect of each category. Tell me the uses of each category. Right. So start with sulfonamide. The adverse effect is ABC rash. I'm having a mnemonic ABC rash. I guess you know the full form. Right. The uses is Septron. I guess you know the full form. The uses is Septron. Give me a thumbs up. Trimethoprim adverse effect, there was no mnemonic. But the important one were megaloblastic anemia, hyperkalemia, and teratogenic. You have to learn these things. Along with this, 2 are common. Aplastic anemia दोनों में है. Aplastic anemia और rash तो हमेशा होता ही है. So these 2 are common. A और R यहाँ का common है. Right? Rest is in front of you. Right? And the use is same. Septron. Septron. The Septron is actually the use of the combination. The combination of the 2 is known as cotrimoxazole or known as Septron. The uses of the combination is Septron. So what is the full form of Septron? S is STD, that is, sexually transmitted diseases. E is enteritis. P is pneumocystis carinii and jejuni. T is typhoid. R is RTI. A is acute UTI. And N is nocardia. Give me a thumbs up. And here the full form of ABC rash. A is aplastic anemia. B is bilirubin displacement, that is carnivorous. C is crystalluria. R is rash. R is rash. A is acetylation. S is SLE, and H is hemolytic anemias in G6PD deficiency. So it is clear till now. Coming on quinolones. Who will tell me the adverse effect of quinolones and then uses of quinolones? Uses is easy. 4G spectrum CT. I guess you know the full form. Just now I told you the full form, right? What were the adverse effects? It is system wise. So it is GIT, then CVS CNS, CVS CNS, then skin and bone soft tissue. Skin, bone soft tissue साथ में ही आते हैं. CVS CNS कह लो दो vital systems and GIT, right? And the last is the pregnancy teratogenic. So you know in each of them what is the adverse effect. Just now I have discussed. Everyone give me a thumbs up. Everyone. So this is how you have to learn in a comparative manner all the antibiotics. I'm going to teach you all. These are only 3 chapters done. I have to teach you 20 chapters today. So today to complete day there is a marathon. So the 3 chapters are done. Let's have few questions on quinolones, which are already asked in your previous year question papers. So the first question is in front of you. Tell me now. Don't rush, please. Read the question carefully, then tell me the answer. Fluoroquinolones mechanism of action in gram-positive bacteria. I'm asking in gram-positive, not gram-negative. So don't be tempted and don't tell me the incorrect answer. Tell me what is the correct answer. What is the correct answer? Yes, Saman, Kishore, Hifza, anyone else? Manohar, Nazia, would you like to try? What is the correct answer? What is the correct answer? So yes, Kishore, you are right. So what is the answer? Yes, Amar, absolutely right. The correct answer here is D. It is D. It is topoisomerase 4. So right. So because I'm asking in gram positive bacteria. I'm changing the question. Gram positive को gram negative बना दूं. तो what is your answer now? अब तुम्हारा आंसर क्या हो जाएगा? किशोर, अमर, others if you want to participate. What is the answer now? If I change the question from gram negative to gram positive, what is the answer? Yes, Sufi, absolutely right. What is the answer now, Sufi? So now, of course, the answer will become A, and you all are right. In that scenario, your answer will become A, right? Topoisomerase 2 nahi hoga, Kishore. It is not topoisomerase 2. So in gram negative, this is the answer. In gram positive, this is the answer. In humans, topoisomerase 2 is present. In humans. But fluoroquinolones do not act on humans, topoisomerase 2. Fluoroquinolones acts inhibits either DNA kinase or topoisomerase 4. Topoisomerase 2 को रोल में नहीं लाना है. It is present in humans. So correct answer here is D. If I change the question, it will become A. Right? So this is the next question in front of you. Can you read the question and tell me the answer? Which of the following fluoroquinolone has broadest spectrum? I want to ask generation 4 का कौन है? I have told you 4 generation. So generation 1, generation 2, generation 3, generation 4. 1, 2, 3, 4. First, second, third, fourth generation. First generation acts against only gram negative and that is limited. Second also gram negative but expanded. Third, along with gram negative, it acts gram positive also. Fourth, gram negative also, gram positive also, anaerobic also. Tell me the name of 6 drugs. 6 drugs in this category. These are the broadest one. So इनमें से कौन है? Ciproflox, Norflox, ये सब तो सेकेंड जनरेशन के हैं, राइट? यहाँ पे मैंने नाल्को बताया था, नाल्को. So Ciproflox, Norflox, these are second generation. If you know nalidixic acid or oxalic acid generation 1 hai, but Trova is the 4th generation. Yes, you all are right. Very good. Trova. So yes, Kishore, Amar, Sufi, of course, the answer is C, Trova. So you should learn these 6 drugs. It should be at the tip of the tongue. Is a 4th generation hai, broadest hai. So make some mnemonic. Kishore, can you make a mnemonic for me? Amar, Sufi, can you make a mnemonic for me? It is Truva, it is Flero, it is Gami, Pruli, Sita, and Cleaner. Sita, Cleena, Pruli, Gami, Flero, Trova. So please take the initial and make some mnemonic and help others also. Can I try? GTP बनाए क्या? GTP. उसके अलावा क्या क्या बच गया? तो ऐसे ही बनाना है mnemonic, right? FCS, SCF, CSF. Okay, चलो बन गया mnemonic. CSF, GTP. CSF, GTP. Learn the mnemonic now. So I myself made. Anyways, so I make the mnemonic in this way only, right? So CSF is and GTP. So CSF, GTP can be the mnemonic. So can you tell me the full form? What is CSF? It is Cleena, it is Sita, it is Flero. Cleena, Sita, Flero. Right? What is GTP? It is Gami, it is Truva, and it is Truli. Gami, Truva, and Truli. So learn these 6 names. CSF, GTP. So CSF, GTP में से T is coming here. Now you will never forget. CSF, GTP is the mnemonic for 4th generation which are broadest acting. No, you will never forget. So always try to make mnemonics, flowcharts, diagram. Book में सब कुछ नहीं दिया है, बाकी सब यहाँ से बनाना है. Right? Have you got it? Shall I proceed ahead? Shall I proceed ahead? Okay, Kishore, it's also good. PSG fails trophy collection. Good. We can use that also if you wish. So PSG fails trophy collection. We can do that. Trophy is true, I guess. Right? And collection is cleaner. Right? And PSG is Pula, सीता एंड ज्ञानी. वेरी गुड. पीएसजी फेल्स. फेल्स का एफ आपका ये हो जाएगा. गुड किशोर, थैंक यू. सो वॉट एवर यू लाइक यू कैन राइट दैट इन योर नोटबुक. एनीवेज, फ्लोरोक्विनोलोन with least bioavailability, least oral bioavailability. Tell me the least one. इसका bioavailability least है. So the four options are in front of you. I taught you this question. Fluoroquinolones with least bioavailability. Is it Norflox, Oflox, Ciproflox or Levoflox? Tell me the answer. What is the answer? Sufi, Amar, Kishore, Priyanka, others. Tell me the answer. What is the correct answer? Amar is saying A. Is it right? Yes. So Norflox is having least bioavailability and Levoflox have maximum. So here I am asking least. That's why answer is A. If I change the question and if I do most bioavailability, answer will become D. So least is Norflox and most bioavailability, maximum bioavailability is Levoflox. So now the two drugs, Norflox and Levoflox, right? Least and maximum. Least is 30 to 40%, maximum is 100%. Absolutely right, Priyanka. Yes. So next question is about photosensitivity. I told you three drugs which are photosensitive. So I'm asking the highest one. I've told you sequence also in the three drugs. What was the sequence? I told you the sequence LSP. If you remember, L followed by S followed by P. So it is L is the what was the full form of X? Is what Lamy or Levo? So what is the answer here? Let me see. The answer here, Lome. L is Lome, not Levo. Lome, Spar and P. So L is Lome followed by Spar followed by P. Now in the option Lome is not there. Lome is not there, right? L is Levo nahi hai, Lome hai. So S is Spar. So I will go with D. The second best is the D. No, you got confused. Kishore, Amar, Sufi, सबने गलती की. L Levo नहीं है. L is not Levo. L is Lome. Lome, Spar and P. Lome, Spar, P. You got my point? So Lome is not there in the option. So don't go with Levo. Levo तो होता ही नहीं है ना. Levo is not at all there. Yes, Amar. Now you got right. The correct answer is D. So second best is Spar. So question is very confusing. You got my point. So again and again I say the same thing to the student. Learning mnemonic is easy, but saying the full form is difficult. Saying the full form is difficult. Now LSP सबको पता है. Every student participating in the exam knows LSP. उसने थोड़ी बहुत पढ़ाई भी की है, तो LSP तो सबको पता है. This is the mnemonic. लेकिन L LEVO नहीं है, L LOME है. ये कितने लोगों को पता है? Right. So as soon as you will see LEVO in the option, you will get tempted. Oh my God, LEVO is the right answer. No, LEVO is not the right answer. You got my point. So this is how we do mistakes. So please say the full forms again and again. Here, LEVO is not, LOME is not given, so go with SPAR. If SPAR is also not given, the P is also given. अगर SPAR नहीं होता तो मैं P लगाती. Right? You got my point. So if SPAR is not in the option, I will go with P. So that is the sequence because others are non-phototoxic. So which is the drug which is withdrawn from India among the following? I have told you the name of the 5 drugs which are withdrawn from India due to some reason. So is it Levoflox? Is it Gatiflox? Is it Moxiflox? Is it Oflox? Can you tell me the answer? Which of the following is already withdrawn from India? Kishore, Sufi, Amar, others. Can you tell me the name of the drug? Yes, Priyanka. Abhijit, would you like to try? Yes, Amar, absolutely right. So Gatti is the name of the drug. So Amar, Sufi, can you tell me why reason why Gatti is banned in India nowadays? It is a recent drug which is banned because it causes hyperglycemia. Severe hyperglycemia. That's why it is banned. So learn the name of the 4 drugs which are banned from India. Apart from this one. So Gatti is banned because of hyperglycemia. Apart from it, Tima is banned because of immune hemolytic anemia. Grepa is banned because of cardiotoxicity. Trova is banned because of hepatotoxicity. And Clina is banned because of phototoxicity. Apart from it, Gatti, which is our answer, it is banned because of hyperglycemia. So learn the name of 5 quinolones or fluoroquinolones which are banned nowadays. Yes. So correct answer here is B. This is the next question in front of you. Can you tell me the name of the drug which is not excreted by kidney? So I want non-renal excretion. That is, I want the excretion in the stools or feces. So which of them is excreted in stools? So frankly speaking, it's difficult to learn. Frankly, it's very difficult. So these are non-renal drugs and these are renal drugs. So non-renal may I mean feces or stool and renal may I mean urine. So you have to learn the list. So I'm reading it once, then I will show you the answer. Non-renal may there are 5 drugs. Nalidixic acid, Grappa, Trevo, P, and Moxie. These are excreted in feces. And renal में बची हुई all other are there. Many are there. And spar is a unique which is 50-50%. Right. Now the question is on non-renal. Non-renal. So question will be from these five. These five. So nalidixic acid, Grappa, Trova, P और Moxie में से जो भी आंसर में आ रहा है तो Moxie is coming. Moxie is coming. If you see the remaining one, they are coming in the renal. Now I know learning is difficult, but you can see the question is already there. I have not treated this question. It is already asked in your previous year question papers in one of the exam. You never know अगला question किस पे आ जाए. लेकिन स्पार को तो अलग से याद रखना ही रखना because it is 50-50% both. So spar is 50% feces, 50% renal. It is a unique drug in excretion. Spar flocks. तो ये तो याद रखना ही रखना. And it's better अगर तुम ये distribution भी कर पाओ. Which of them are in non-renal and which of them are in renal. You got my point. So try it. Try it out. So I am done. Till now I am done with 3 chapters. So I taught you sulfonamide, trimethoprim, and quinolones. The 3 chapters are done. That is nucleic acid synthesis inhibitors. The first 2 are indirect, the third one is the direct. We are done. We have done all the possible details in each of them along with the practice questions in each chapter. Everyone give me a thumbs up. Now, next I will start protein synthesis inhibitors. Here I would like to take these 4 drugs in a comparative manner. So I will ask you to make a comparative table between tetracycline, chloramphenicol, aminoglycoside and erythromycin. The most important and interesting session that is going to happen now, right? So we will compare these 4, the big chapters. So 3 plus 4 total 7 will be done, right? These 4 are protein synthesis inhibitors. So I will give you in the same headings. We will be comparing them. Just a second. In the same heading, we will be comparing. Let me show you. Here you can see in the same manner we will be comparing these 4. Fill this table completely one by one, taking one by one. It will take 15 to 20 minutes each of them. Maybe I will require 1.5 hours for this session, but I will take this in episode number 2. I would like to take a break for 15 minutes now, and after 15 minutes I will rejoin the episode number 2 of antimicrobial drugs on YouTube only and continue with protein synthesis inhibitors. Thank you for being with me in episode 1. Thank you for giving your precious time to me. I request all of you to take a break for 15 minutes and come back. Join the session back.